Pode pôr. O vídeo. Precisa entrar o vídeo.
Olá, meu nome é Manuel. Atualmente moro na cidade do Recife, aqui no estado de Pernambuco, no Nordeste.
Hello, my name is Muriel. I live in Recife, in the northeast of Brazil.
A robótica educacional entrou na minha vida quando eu estava no ensino médio, no terceiro ano, e daí me encantei para aquilo e pensei, por que não trabalhar com isso? Hoje em dia trabalho com robótica educacional em algumas escolas aqui na cidade do Recife. Não tinha na minha casa internet, tinha na casa da minha madrinha, e daí se eu quisesse baixar um filme ou jogar, eu teria que me deslocar até lá. Acredito que por volta dos 16 a 17, minha família contratou esse serviço de internet, e daí, a partir dessa data, eu tive internet na minha própria casa. A internet ajudou 100%, acredito eu, no descobrimento da tecnologia, né? Eu comecei a pesquisar aquele material no YouTube, uma plataforma onde existem diversos vídeos de professores e pessoas que têm acesso. Que isso foi uma virada de chave muito importante na minha vida, porque trouxe o interesse ainda maior, ao ponto de eu querer fazer um curso superior voltado para isso e ao ponto de eu trabalhar hoje com isso.
Boa tarde. Antes de iniciarmos,
Good afternoon. Before resuming, please make sure your cell phones are on silent mode, please. Now, continuing the international seminar, Cetic.br, 20 years data and analysis for an inclusive digital future, we are going to have our second keynote session, Digital Health and Impact of Artificial Intelligence, reflecting on the transformational impact of digital technologies and AI in healthcare, as well as on the challenges to expand universal access to universal health. It will also provide a balance of the evidence that have been available so far and prospects for the future of digital health. Now we have our keynote speaker, Dr. Daniel Luna, head of the Health Informatics Hospital of the Italian Hospital in Buenos Aires. Daniel has been one of the creators and coordinators of Medical Informatics Residence Program of the Italian Hospitals of Buenos Aires. He was responsible for leading the development and implementation of the clinical information system of that organization, has worked as a medical information director for 10 years after he took over the health informatics chair for until today. He has also taken part in many development programs in the region, including a health informatics program. Dr. Luna, you're most welcome.
Bueno, buenas tardes. Muchísimas gracias por
Good
la
afternoon.
invitación.
Thank you so
Para mí
much for the
es un honrado
invitation. I'm greatly honored to
contarles
have you here so
algo
that
de
I can
mi
take part
experiencia
and share with you
de
some
una
of our
manera,
experience in a way.
la diapositiva. Ok, esperamos. Eh, Adelantando un poco
So,
el contenido de la
talking a little
presentación.
bit about the content of my presentation.
Yo me presento, soy médico,
So, I am
más de
a
30 años
doctor,
trabajando en la
more
medicina
than
y la
30
tecnología.
years working with
Estuve a
medicine and
cargo de
technology.
armar el proyecto de
I
crear el
have been
sistema
in charge of
universitario
many
del italiano
projects
en
of
Buenos
creating the
Aires,
system for the hospital,
hospitales,
and the
varios
Italian
centros de
hospital in
atención
Buenos
primaria
Aires is a
diferentes
big
niveles
hospital with many
y tiene
different
una
primary
universidad.
healthcare
Y desde ese
centers.
punto de
I also
vista
work
ha
at
sido pionero en
university,
integrar
and I have a
de
pioneer
alguna
at
manera el desarrollo de
integrating
aplicaciones y
to
tecnologías
develop
tanto de información como tecnologías médicas
technologies and
en la región.
applications
En ese
in the
contexto,
region.
eh,
So within
la
this
idea para
context,
contarles
the
es,
idea, just to
voy a
share
hablar
with
de
you,
inteligencia artificial,
I'll be
obviamente es un
talking
proyecto muy
about
largo, lleva
AI.
muchos
Of
años,
course, this is a
debido a
very
eso
big and long
muchas
time
lecciones
project.
aprendidas para compartir,
And
voy a
I
tratar de
learned
poner
many
de
lessons
alguna
that I
manera el
can
foco en
share
esa
with you,
inteligencia
and I
artificial
will
porque
try and place the focus on the
no
lessons that
todo
we
desde el
have
punto de
learned.
vista de inteligencia
Not
artificial está
everything in
perfecto,
terms of
de alguna manera
AI,
genera
not
una
just
suerte
that,
de
because
mainstream en particular. El
it's
Hospital en
kind
Atención
of
a la Información ha
mainstream.
sido
The
acreditado
hospital, its
por
information
calidad y
system
seguridad
has
mediante el
been
Joint
accredited
International Americano de
in
Datos
quality and
y por el otro
safety
lado por
by the Joint
HIMSS,
Commission
nuestra primera
International and
una
CAP and
clasificación
HIMSS.
de
We are
modelo de adopción de historia clínica electrónica donde el nivel 0 es
we
todo
are
papel, nivel
we
7 es
went
todo
from
informático.
07
Esto
being
para
fully on
mostrarles
paper and
la columna
level 7
vertebral,
totally
el sistema
paperless.
nervioso
So
de la
the
organización hoy es su sistema de
backbone of the
información.
organization today is
En esa
its
lógica
information
no
system.
voy a hacer una introducción
So
de la
I'm not
inteligencia artificial,
going to
pero
talk
sí
to you to
quiero
explain
de
what
alguna manera mostrar una
artificial
instancia
intelligence is to you, but I'm
en el
going to
tiempo.
show you
Y cuando uno dice inteligencia
its
artificial, lo
evolution a
primero que
long
tiene que
time.
decir
And
es
when we
cuál,
talk about
para qué,
artificial
con qué.
intelligence,
Y
which
desde el
one?
inicio,
For what? What are
dado
you
de hasta la
talking
fecha,
about? So
han
ever
existido
since we
como
started having computers, there have
dos
been two
grandes áreas.
major
La primera son los
areas.
denominados
The
sistemas
first one
expertos o
is
los
what we
sistemas basados
call
en
the
conocimiento,
systems
el
based
conocimiento de
on
una persona, en este caso la
knowledge,
salud, el
not
conocimiento
the
de un
knowledge of
profesional
a
de la salud,
person, but
que
the
se
knowledge
encapsula,
of
se
all
controla, se
persons
pone en
that
una
know about
regla y
healthcare.
luego se genera
So
un
you
output, una
collect
salida a
everything,
ese
and
proceso.
there is an output.
Esa es la primera parte de
This
la
is the
inteligencia
first
artificial.
part of
La segunda
artificial
es lo que se
intelligence.
denominó
The second
machine learning
part
o aprendizaje
is what
automático,
we call
en
machine
donde ya no
learning,
eran
uh,
basado en el conocimiento, sino
where it's
basado en
no
los
longer
datos.
based on knowledge,
Muchos
but
datos
rather based on
que en algún
data.
momento
So
la
you
cantidad de
enter
datos que
lots
va a
of
poner
data, and at some
van a
point,
generar la
the data
inferencia
that
por
you're going
patrones.
to
Y esos son
enter
los modelos de
will
machine
identify
learning o
patterns.
aprendizaje
And
automático.
this is
Y por último
machine
aparece
learning.
una tercera
And lastly,
subdivisión
there is a
en
third
machine learning que se
subdivision
denomina deep
within
learning,
machine
que a
learning
partir del
that we call
2010
deep
aparecen
learning, that
redes
after
neuronales de aprendizaje
2010
profundo que
is
también
the
vinieron a
deep
cambiar
neural
muchísimo.
learning
Hasta acá la cosa venía
networks.
más o menos tranquila.
And until
Había
here,
veranos e
things were kind
inviernos.
of okay.
Veranos donde los
So there
estudiantes
were
podían decidir
summers and
cuánto volaba
winters,
el
depending
gobierno,
on
la industria, la
how
academia, el
much there
Estado,
was
cuánto ponía
in
de
terms
dinero,
of
cuánto ponía de
production, how
inversión
much
y
money
cuánto
was
se esperaba del
invested,
retorno de esa
how
inversión.
much
Y
you
cuando
expected in terms
hay
of
mucha
return to
expectativa, aparece un
investments.
verano,
And when
y
there is
cuando la
lots of
expectativa se
expectation, there
ve
is a
de
summer.
alguna
And
manera
when expectations
no
are
realizada,
somehow
aparece un invierno.
not
Los
realized, there
inviernos,
would
hoy
be a
estamos en
winter.
un
There were two
verano
winters, and now
absolutamente
we are
caluroso y
in a
abrasador,
absolutely very hot
porque
summer
llega la cuarta ola y la cuarta ola tiene
because
que
it's
ver
the
con
fourth wave, and
inteligencia
the fourth wave
artificial
is
generativa.
related
Algo vamos
to
a conocer después.
generative
En
AI.
esa lógica, el hospital
Within
desde
this
fines de los
logic,
90 que
the
inicia su
hospital in the
proceso
late
de
1990s
diseño de
started a
transformación y
process
empieza con un plan
of
maestro.
implementing information
En ese
systems with
momento
with its master plan. And from then on, we started thinking about dreaming because clearly there was, and I remember right from the beginning as the working in internal medicine. So we were thinking how technology could help us make decisions. And then there was information. It was much more than just entering information, but at least it could give us recommendations. That's what we wanted. So I'm going to tell you each one of these steps. So first, we're talking about terminology. Terminology server. It was very good 30 years ago, of good decision, because doctors didn't have to enter codes, and we had to teach it. And this is a common mistake that most information systems make when they make doctors choose a code. But this is not good for doctors because doctors have not been trained to do that. So we created a complex software that had something of natural language processing and some processing to have narratives in order to store information. This was very good because considering the new technology, this is the raw material like oil of, from which we can obtain new products. And then we got a little bit better. We had some natural learning processing. Then we had expert systems. And then we went to automatic knowledge. And then we created a program encompassing all techniques because technology changes, like building a team, and the most important, to always make sure that the tools that we created could be included in the workflow of workers. It would be useless to have something and you just publish a paper. We needed to succeed that whatever we were developing could go along with the care delivery process. This was very important because there are different types of technological tools that do not respect care delivery processes. And this is a problem. And then we created machine learning and deep learning algorithms, and which is not easy for digital images. So there is a pixel, a number of pixels that is very easily computerized, and then we started creating many lines, more than 15 at some point in time, with different techniques, different modalities for different kinds of images to try and help radiologists that need to try and interpret images. And I'm going to show you some of the solutions that we have created. So we created a good model for the data. And lastly, we created a first chatbot, first generation chatbot during the pandemic. And it's like a level R at a call center chatbot did very well during the pandemic. However, advancing in the process after the pandemic with everything that is implied for the team working there, because during the pandemic there was a major flee of talents. And then we generated more data, and obviously we had the deep learning, and then this changed everything. And then we had OpenAI with ChatGPT and everything else that followed, that comes as it's very fast. Every week there's something new. So within this logic, the objective of the informatics department that is very much related to the care delivery process is a transdisciplinary, to have a process of innovation in a lab, for example, and try and see how feasible this is to translate this to the real world. And once we are in the real world, that this can be implemented and included in care delivery processes. And this has always been our guideline. There are different steps for us to do that. This is to develop a new algorithm and also to assess an existing algorithm. So here, I'm going to share with you a few examples and a few of the lessons that we have learned with each one of these. The first thing we worked with, of course, was something related to support systems uh, the, to support decision making based on expert systems, based on rules. So one of the first things that we did that is that the calls for more work and more difficult was to use standards. Um, we did this with standards, so it makes it more complex to use FIRE as a data model, to use CDS and rules as for the rules, and then we only have two organizations that could consume the rules that we had created, but it was very cumbersome and lots of work was involved in creating this. Number two, we clearly understood that considering the literature said that a large percentage, whenever there is a warning, an electronic record, between 75 and 95% of the times, professionals will ignore it, will cancel, ignore, and move on with their first decision. This gets the attention, and most times when we assess, they are right, because the knowledge bases were poor, because the interface was not so good, and we had to work intensely to create something that we call a user-centered design, and always based on a model that they should do everything in order to assure patient safety, and whenever possible, they would justify something that was not so common. So we created this model of the rule-based expert systems. So the clinical decision support system, more than 60 rules, something that is very complex, that requires lots of work, and you can't model rules, not just complex, but also that require many steps and serve for simple things that somehow have more no more than 3 or 4 steps to make a decision, and then we try to do it, and it got more and more difficult because physicians make decisions, and when you look at the interface, clinical history, and each one of the phases, the system would stop, and doctors don't like that. So within this logic, for each rule, we needed to create a database that could store all the elements that will feed into the rule. For example, in the case of a warning for a drug allergy, so allergies needs to be well documented, as well as all the drugs. And whenever someone prescribes a drug, they could see the possibility of allergy. So this is related to the main large language models. Uh, it's in You can deal with it in many different ways. This is requires lots of work, and it's very laborious. And so, for example, here at the right, you can see each one and the base where it is stored. And then we had 8,000 interactions. About 400 were clinically significant, but 8,000 for the doctors. So they're going to annul. So we need to be very specific, but also sufficiently sensitive in order to find the clinical cases that really are meaningful. And then drug laboratory, maximum dose, toxicity. And within this logic, the most difficult thing for us to learn was that every time you add this type of technology, there are new barriers and new pathways for errors. So this is very important with decision-making, decision support systems. It's important to have a team monitoring all the time everything that happens to see what workers are doing. It's not usual for in health informatics for us to assess. We just implement. So one of the first recommendations that I would make any implementation of a system that is going to be used at clinical level, you need to assess it because there will be new pathways for errors with unintentional consequences that might worsen something that you wanted to improve in the first place. Within this logic, they've been related to natural language processing. And so we developed technology that the doctor shouldn't code. So we had three objectives. First, I wanted to identify clinical entities. And once we did that, it would be available through different organizations, and this was good because, for example, the government of Uruguay consumes this service, but it's good to control small text excerpts. So a diagnosis, the reason for an appointment, but not a long text. You're not going to find instances referring to others. For example, breast cancer in a free text. I don't know whether this refers to the patient or to a family person. So if you find this, finding the relationships is usually a problem in the natural language processing. So we created a model for the entities, and we used this as a reference vocabulary. And then we had our own vocabulary that took us 10 years to build. And then when it started working, because this requires natural language processing that are with rules that are very complex, and then this is what we obtained. Which makes no sense, of course. It took us more than 15 years working with a group, and fortunately, the person who was in charge of this was the head of computer linguistics at university that continued to work. And once ChatGPT appeared, first he wanted to commit suicide, but he is the one who assumed the control of the project that I'm going to show you at the end. And then so using this model for entity recognition and different abbreviations with doctors in any language, we use lots of abbreviations and acronyms, and this creates many problems for understanding. So the system was working, would find the entities, and there was the workflow. Whenever the doctor wrote a free text, we try to control the terminology. This terminology control serves for an analysis because there is a rule for data analytics. And then, for example, you can refer a patient, for example, for chronic disease management. So different rules were fed by input on any type of clinical entity that had been previously coded. So free text was only used from that standpoint. We also created, as a terminology, we had a transcoding and auto-coding services, so the texts were here and automatically withdrew any system of transcoding that we used. All of this going on until after the pandemic. We also worked we wanted to have the bedside. So in the office, bedside and care delivery, so that you wouldn't have to write. And most importantly, so that you could have the information that were most important, because they are more important, the least less important, and this is related to the decisions that you make. So the objective was to succeed in making decisions and the decisions that would be made by the older professionals rather than by the very young residents. So this model also based on large language models took 15 years because all the models that we see working, and they work much better if you can train in each one of the domains, because the problems of speech recognition is precisely that you needed to train it. And today, the models are well trained, and this local training per specialty is no longer necessary. So there was each one of the specialties. In computer vision, so once again, using lots of machine learning techniques and deep learning for CT scans starting from the breast images. So thinking of quality validation and validating it in the real world. For mammograms, we started with breast density. It's like seeing the sun on a cloudy day or a sunny day. So sometimes things are hidden behind the fat in the breast. And the number one thing was breast density that has a model, but it is very operator dependent. So we automated this, and we had a performance that was equal or even better than radiologists. So there was a workflow. Whenever there is a mammogram during the night, there is an algorithm. It first finds the breast density and then any lesions using a mask model, and then it produces an automatic report that a radiologist specialized in mammograms will validate or not, and then it's tagged, it's a control model, because and they are the ones who see the conditions, and then we put it in production so that anyone could use it. Same thing we did with chest x-rays, because 50% worldwide, 50% of the chest x-rays that are ordered all over the world, no one ever sees it. No one does anything about it. And here, different algorithms, different pathologies and different technologies, we had different algorithms. So this took very, very long time, a big team. But if there is a pneumothorax, this is a critical finding, and it may even take a patient to death. Whenever a pneumothorax is identified, the algorithm sends a message that saying that it is critical. Then we call the doctors requesting it and the treating physician, and then we do a specific assessment. And many times we needed to go get the patient at home because we had seen and the system was working, and there is a severe finding, this is pneumothorax, and the patient didn't have any symptoms, so we had to go get them. This was very good. And then just to give you an idea, so these are the ones that are working, but all of them modified for three reasons. First, because the majority of people who were in the team have left during the pandemic, the engineers, those writing the rules, and obviously they go to places where they can have a better professional economic experience. So we need to be constantly training people. Second, because the market started generating better algorithms. And number three, because the literature changes, and today we need to train people with 300, 400 images, and then it became 3,000, 4,000, so much slower, and then they were more effective even than the algorithm. So that's why we are in a process of seeing, and obviously there is a change in the paradigm in the market, as you're going to see. So this is Kairos, a system for intracranial hemorrhages. We really were surprised, hemorrhage and ischemia. This is for the spine. And was a surprise, because it makes no sense using it, because it provides no care delivery benefit or no economic, because I'm going to reduce some healthcare cost, and doesn't work. Lastly, to end the chatbot, we started before the pandemic with a clinical chatbot. As you can see, there is a menu, and we found a clinical chatbot that we prepared to prepare the telemedicine process, where there was a very fast medical history, and chatbot didn't ask questions, but it prepared the questions for the appointment. So it was positive, and so it worked as a screening. For example, separating patients with fever and without fever, because the ERs or the emergency departments were too full.
1 year after the pandemics and the chat GPT, here we are designing our own process, expecting that the technology should become more mature. Over here, you can see a static plan of what we'd like to do until we reach those more dynamic plans. We start with a static one, a reg, which is a base that will put that into some context, and agents, which are related to the elements of the baseline, where information is being controlled by codes. This is a model which is a LLM integrated into the EHR, and I have a chance to decide which LLM which will work better for the answer. The problem, however, is that I have to put that into context so the machine will understand what my prompt is. So to be really effective, I should have shared all my data for a fine tuning, and we decided no, forget about that. We cannot disclose all patients' information due to ethics and other issues. And this is the LLM model where there is an orchestration of the question. The prompt is orchestrated. LLM says, this is what I need. And then they go after all the 110 million documents of narrative texts that we have about clinical data. And they tell us which ones are relevant to the prompt. And if there is any structured model with the drugs, with the studies, whatever, and free texts of the vector, more or better control data. So we send all of that to LLM, which will give an answer according to the pre-neural model. And then we would implement the last 2 months, and that has changed widely the way as many providers have been working. So I have a prompt, double click, and then here I am. I am within a record where we have 25 years of clinical data of a patient. The patient who is allergic, and not just to know that the patient is allergic and then to set an alert not to give in a certain drug that may drive to allergy. Not only the chart where it says about allergy, but if anybody else has ever reported any allergic episode in those 25 years of medical record. And we have a number of assessment medical record reports telling us how things are working currently. In some of the instances, I may ask, and then we have the goal is to get to the office where the physician will just throughout the smartphone and the mobile clinical medical history, it will be able to listen to a summary of what patients reported, physicians, and then physician will say, well, I want to get such a certain drug prescribed to this patient. Then a summary, the physician will get that information, and the system cannot work by itself. It has to be revised and controlled by a health provider. Within that same reasoning, and I'm about to close, 1 minute to go, technology is always a means, never an end in itself. And if we forget about that, we are going to generate problems, iatrogenesis, and several other problems. Therefore, the technology as an option and artificial intelligence, they are what they call bring their own AI. Like we used to say, bring your own device. Now it's bring your own AI, where providers and patients will come with Dr. Google, Dr. AI, Dr. Chat GPT. I cannot prevent them from doing that. And I do need to create other models that will help them to learn how to use it throughout a domain. All of those who sell software will also sell their solutions, and they have to wait for them to mature. And third, this applies especially to information systems and development. And in addition to that, remember when I presented all the services, the first question that a boss asks is, may I let that information mentioned throughout the chat GPT? And the answer was not. If you read up to date the New England Journal of Medicine, you are not writing as if you were writing a book. The decision is your own. And this is the primary goal and the first recommendations. And they have to be very careful and cautious because all these issues, they may end up generating wrong information. And ethics, it is a very important tool. That is a tool of those who design and those who use them. So ethics actually are on the hands of those who are the users. An ontological and ethical model of a responsible use may be done thanks to organizational process. Here we have some lessons learned. Governance, it does not matter if you develop them or not, but that should lead to a high level of assessment, care levels. Also, transdisciplinary teams are required for people who will be working at the organizations and that will follow some models in place. And third, 80% of the challenge lies on people and not just technology. Technology in health is a socio-economical challenge and not just a technological burden. That's why in health sector, technology is always lagging 10 years behind. And we are always, concerned about models, or I mean, we rely on models back from the 90s or the beginning of the years 20s. And many years later. So we are afraid of changing the way as we work. We are going through a very intensive paradigm change, and we have to have a high availability for that, thanks to the use and implementation of systems that drop, and we have to guarantee a high availability and not allow systems to drop, not only to AI, but to any other level of information system. So please check, double check that you have a plan B to support yourself in case of any disaster and to get users and consumers consensus whenever they're going to work and if the system is not available. A patient sometimes is dependent and providers, they rely on the technological perspective, and we do need to have a different type of technical support. Patients, they may wait in the lab, but they may not wait in the surgical center. So we do need different models. Then we have to work as a clinical support to them. Security, quality. We cannot have a technology center if that is going to go against security or safety mode. So in a summary, data is key, and we have to rely on every possible data, regardless of the format. The technology will be embedded right after you verify the project. And then here you have issues which before were impossible to be double checked. In one single professional life, sometimes it's difficult to check everything out. But now with the new models of AI, so it's very important that everyone participates. It's very difficult to model those care rules, but we have to let everyone to participate and to implement tools that were not thought, were not desired by the care team. So we always have to have a tool available to others. Probably the security concepts as to cybersecurity, that is a very important concept. That's a business. Cybersecurity is a business. 100% of security will never be possible, but at least we have to know what to do in case we have a breach or a gap in terms of security. And that will just work based on metrics to know what is happening, to know if that has improved or not the care which is given to our patients. Also, people capacity building. We have to have people who are skilled to deal and manage our patients. We have to have stages, a provider who is 60, who is almost by the end of his professional career. Doesn't make any sense to start from the very beginning. We have to have accessory models to follow it. Thank you so much. My goal was to share some experiences that I have had in the past years. Thank you. Thank you so much, Mr. Daniel. Please stay with us. And to moderate this debate, I'd like to invite Luciana Portillo, who is ICT surveyor, and you are mostly welcome. And we are going to invite a group of experts, starting by Ana Estela Haddad, who is in digital and health information by the Ministry of Health.
Eletra Ronque,
Mrs.
consultora da
Elettra
Science
Honk, who is
Pool
a
e da
consultant at
OMS
Science
Europa,
Pool and WHO Europe.
e senhora Eimar Marim,
And
coordenadora
Aymar Marin,
científica da
who is a
pesquisa de
scientific
saúde.
coordinator for ICT Health.
Contamos ainda com a participação remota
We also
do senhor Davi
are
Novilho,
gonna have
chefe da
remote
unidade e
participation of
consultor
the chief
regional
of
da
the unit
OMS Europa.
and regional consultant
Bem-vindas
for
e
Europe
bem-vindos. Passo então a
WHO.
palavra à
Welcome
moderadora para
all,
o
and
excelente
now I
debate de
will give the
vocês.
floor to our moderator, and I wish you a very profitable debate.
Obrigada. Boa
Thank
tarde
you,
a todas e
and good
todos.
afternoon,
É uma
everybody.
honra
It's a great
mediar esse
honor
painel
to be
Saúde
the
Digital e Uso
moderator
da
of this
Inteligência
panel
Artificial
addressing
com nossos
digital health
convidados
and
aqui, que
how
são
will AI
referências,
impact
nessa
that
área,
sector.
tanto
We have
nacionalmente quanto internacional.
experts here who are
Muito
referenced
obrigada,
in this field
agradeço por
nationally and
aceitarem o
internationally.
convite,
Thank you so much for accepting
compartilhar com
our
a gente todo
invitation
esse
and for
conhecimento,
being
essa
here and to be
experiência,
able to share all your
e que
knowledge,
todos aqui
experiences.
participaram dessa história do CETIC e
You all
da
have been
pesquisa de
part
saúde
of
também
those
em
20
nosso
years of
lado. Muito
CETIC
obrigada por
and the
compartilhar esse
ICTs which
conhecimento
you are
e a gente vai ter
conducted
um momento
in
de
our
reflexão
hub.
aqui.
Thank you so much for your time.
O tema do
And there
painel,
we go.
né, esse tema ele é
This
extremamente
panel's
atual e
topic is
desafiador.
very
Nos
current
últimos
and
anos, temos
challenging. In
observado
the past
avanço
years, we
expressivo
have
na
been
adoção
observed
de
a
tecnologias digitais no
meaningful
setor da
advancement
saúde no
in
Brasil.
digital
Esse
technologies
progresso
in the health
inclui a
sector in
ampliação
Brazil.
do acesso à
Such a
internet nas
process
unidades de
includes the
saúde,
expansion
adoção de
of
prontuários
internet
eletrônicos,
accessibility at
oferta de
health
serviços
units,
de saúde, entre
electronic
outros.
medical records,
Também percebemos
telehealth,
um uso
among
crescente das
others. There
tecnologias
is
pelos
also an increase
profissionais
in
da
use of
área,
technologies
principalmente
by
na
health
prática
providers,
clínica.
especially in
No
their
entanto, ainda há um
clinical
longo caminho percorrido.
assessment.
O
However,
uso
we
de
still
ferramentas
have
mais avançadas,
a
como
long
Big
way to
Data,
go. More
inteligência
advanced tools
artificial
like
e
such as
Internet das
big data,
coisas, permanecem
AI,
restritos
Internet of Things,
a um número
they are
reduzido de
still
estabelecimentos.
restricted to a
A
minority.
segurança e a privacidade dos dados em saúde
Security
também
and
são
data
aspectos que
privacy in
exigem
health
atenção
are
especial.
topics
Além disso, persistem
which
as
also
desigualdades,
required
tanto
special care.
regionais quanto
We have a
estruturais, bem
persistent
como dificuldades de qualificação
inequalities
digital
as
entre
well
os
as
profissionais de
inability of
saúde, que
digital
representam barreiras
skills within the
importantes
health
para a
providers.
transformação
And
digital
those
mais
will
ampla
represent
e
important
inclusiva.
barriers for a
A
more
CETIC acompanha esse
broader and
cenário há mais
inclusive
de uma década
strategies.
por meio da
CETIC
pesquisa
has
Cic
been following
Saúde,
that for
realizada
over
desde
one decade,
2013.
since
Essa pesquisa tem sido
2013 when
essencial para gerar
ICT
dados e
Health
evidências sobre o
survey
uso das
started. The
tecnologias
goal is to
digitais nos
generate data
estabelecimentos de
and
saúde
evidence
brasileiros.
about digital
Ela
technology
investiga não
in the
apenas
health
a
premises
infraestrutura e
in
as
Brazil,
aplicações
searching
disponíveis,
for
mas também como
infrastructures
médicos
and
e
applications,
enfermeiros
as well
usam
as
as
how health
tecnologias
providers and
digitais
nurses they
na
use
prática
the
clínica
digital
e quais os
technology
principais
in their
obstáculos para a sua
clinical
adoção.
routine and what are
A
the main
pesquisa Cic
obstacles
Saúde
for their
surgiu a partir da
adoption.
adaptação
ICT
do
Health
contexto da América Latina
emerged
do
after
framework metodológico
a
recomendado pela
methodological
OCDE.
framework recommended
Esse
by
processo foi conduzido
the
no âmbito do grupo de
OECD
trabalho sobre
that
redução
was
gastos
proposed
da
by a
Conferência
work
Estatística
group
das Américas, a
in the
CEPAL,
Statistic
com apoio
Conference
da
of America,
Organização
CEPAL,
Pan-Americana de
and
Saúde,
also
a
with the
OMS.
support
O
of
CETIC foi
the
pioneiro, né,
WHO, Pan
na
American
realização dessa pesquisa na
Institute.
América
CETIC
Latina,
was a
aqui no Brasil,
pioneer in
e
conducting
também tem
such a
atuado em
survey
outras
in
iniciativas
Latin America
regionais e
and is also
internacionais.
performing some other national and
Alguns
international
exemplos recentes têm
initiatives. Some
sido a
recent
parceria com o
examples
Banco
are
Interamericano de
partnership with the
Desenvolvimento, com a
Inter-American
OCA, que
Development
tem
Bank
incentivado outros
and
países da
with the
região da
PAHO,
América
which
Latina
is being
a
motivating other
adotarem o
countries of
framework
Latin
Cic
American
Saúde
continent
para
to
desenvolverem
adopt
suas próprias
the
pesquisas.
ICT health
Além disso,
framework
publicamos
for
estudos na
future
edição da saúde
researches.
digital, com
We also have
recomendações
digital
metodológicas,
measurement health
organizada em
with
parceria com a OCA,
methodologies organized
e também um
in
relatório
partnership
monitoring da
with PAHO,
implementation of
and
digital
also the
health,
report
organizado em
monitoring the
parceria com a
implementation of
OMS
digital
Europa,
health in
cujo
partnership
o
with
coordenador é o
WHO
Davi Novilho,
Europe, and
nosso
Davino Vilho
convidado,
is the
e também sim em
coordinator of
parceria com a
this
Eletra e com as
program
direções da
in
Imara
partnership
aqui
with
nesse
the
momento.
Electra and also
Esse
contribution
relatório,
of
ele
Imara and
analisa
our
metodologias
guests.
de
The report
medição de
analyzes
saúde digital em
measurement
8 países
methodologies
por
of
algumas
digital health
organizações
in 8
internacionais.
countries by
Além
some
disso, ano passado a
international
gente lançou o estudo
agencies.
de IA na
Last year,
saúde,
we
que
released
explora as
a
potencialidades
project,
riscos e
AI in Health,
perspectivas
to
do
understand
uso da IA
risks
no
and
Brasil.
perspectives for the
Nosso
use
painel de
of
hoje é uma
AI in
oportunidade para
Brazil. And
dialogarmos sobre
today's
essas
panels
transformações e
allow an
recursos, as
opportunity to
possibilidades
talk about new possibilities and challenges placed by AI and future pathways to guarantee that innovations will promote efficiency, sustainability, and equity in the health system. Once again, thank you so much to our guests and all participants on site and online. So I will start with a first round of questions to our guests, and then we may open for the public, for the audience. The first question goes to Elettra. Take into account your leadership in the working group of the OECD addressing digital health. What were the main objectives reached in terms of measurement, and what should be prioritized nationally and internationally? I hope you got the question.
This should be, you can hear me, right? So thank you very much. I'm really very pleased to be here and participate in this special event celebrating 20 years. Okay, 20 years of Cetic's work in delivering data and analytics for evidence-based um, policy in the digital economy. And I'm particularly pleased to be on this panel because this area, digital health, is an area where Cetic has invested significantly over the years. So in answering your very first question, in terms of achievements and what were the main achievements of this work of the OECD, WHO, and European Commission, let me mention, because it was actually quite an international group that came together. Let me just bring back some personal reflections, since this was a little bit what was happening all day today. It's going back in the past. And we're talking about 2011 here, 15 years of collaboration with Cetic. At that time, I was responsible at the OECD for work on e-health. Many governments were investing significantly in digital health infrastructure with very high hopes of improving patient access to care, improving patient safety, and improving the efficiency and productivity of healthcare systems. But things were not going all that smoothly. All countries and all governments were experiencing the same exact problems and challenges. Low level of adoption, very poor interoperability. The systems that were put in place were simply not talking to each other. There was low public trust. So what became clear is that if countries wanted to learn from each other in terms of what was working and not working, and did not want to replicate the same mistakes, we needed at least a compatible measurement framework. A framework that would bring together some compatible and comparable indicators internationally, aligned methodology, and consistent definitions. And as you know, because you were part of that, this coherence simply did not exist. So that's when the WHO, which actually was working similarly in creating, in trying to create and monitor digital health implementation and adoption globally, and the European Commission and the OECD came together. And the main breakthrough, as you mentioned, was this OECD model. We call it OECD, but in fact has been a joint model survey framework, which was flexible enough to be adaptable regardless of the digital health maturity of a system. It was really, it's a survey model that you've adopted, and you actually were able to scale in Latin America, and you piloted for the OECD, WHO, and European Commission. But I think the main breakthrough of this model survey really has been bringing the focus, as we've heard, matters, from the digital tool itself to the functions of the tool. That is, it is totally technology neutral. That means what really matters is what the tool intends to do, the functions, the care for which the tool is used. And as you presented some of the data recently of your report, which are quite astounding in terms of how over the years, because you started in 2013, right? So you can see how this electronic health records have now are now being used for accessing diagnostic data and adverse reactions of patients and so on. Going to your second question, and so looking a little bit in terms of prioritizing what will have to come next in terms of priorities regionally, internationally, let me mention three areas that are very important. First of all, we're seeing a fundamental shift from digital health tools that are developed for institutions and healthcare providers to digital health tools to empower the individual, to empower the patient. We're talking about patient-centered care. We're moving into a smarter type of health management where the patient is called to take part, be an active player of its own health. But if the patient cannot access its health data, cannot access the electronic health record, clearly this is very difficult. This brings new challenges in terms of monitoring because we need to monitor access by the individuals and also the way the data and the information is accessed and used. But there is a lot of progress happening. In particular, I would like to mention what is going on right now in the European Union. The European Commission has developed and is developing a monitoring framework aligned with the European Union Digital Decade Agenda and the European Health Data Space, which calls for having 100% of EU citizens access their health data and electronic health record by 2030. There are some very interesting also development at the OECD level now with the patient-reported indicator survey to look at patient reported experience of care, which matters. The second area I would like to move to is governance. And this is a fundamental one, and particularly important now that we see how artificial intelligence is being layered on top of the digital health systems that exist. And the recent report from the WHO, the Global Report on Digital Health 2023, indicates how 56% of countries either lack governance arrangements or the governance arrangements are unfortunately non-functional. This makes, just as an example, many countries in Africa have privacy legislation in place, but they simply do not have the resources, they do not have the arrangements that are functional in place. So this is an area also that the OECD has been following very carefully with its health data governance recommendation, which we're monitoring and has been monitored since 2016, because health data governance is fundamental as we move into artificial intelligence. And what this recommendation does is has created guidance for governments for putting in place the appropriate frameworks, not only to protect the data, but also to enable its use for public research and for secondary use in a responsible way. And third and last is system readiness. Because what we're seeing with digital health and also AI is how many of the digital health tools are put in place in a fragmented way, and policy is siloed. So the digital transformation requires coordinated whole government coordination at highest level. What we're seeing is workforce that is not trained. We're seeing interoperability not in place. So the need for having an approach that takes in account all of the policies that are needed. And here WHO and the OECD also are developing complementary approaches. The WHO has put in place a digital health maturity framework and the OECD digital health readiness framework that are very complementary. And they're necessary to really identify where some of the policies are lagging behind and having the system-wide approach that is needed. So let me conclude here, and I hope I'm within the my time frame, just to indicate and just wrapping up that putting in place digital tools is just the very first step. but really there is all the rest that we need to take into account, particularly the equity, the empowerment, and the care that is needed and the health outcomes. And there's a lot of work to be done still here. Thank you.
Thank you. Bom, a segunda pergunta vai para o Davi Novilho, que participa online.
Second question goes to Davi Novilho, who is online. Take into account your experience in the coordination and initiatives of digital health. Which are the best practices to measure digital health at many countries? I'm sorry, we have some echo.
I'm really struggling for not having the opportunity to be there because I really love to be there with all of you. But I woke up in Slovenia today, then I was in Switzerland, and then I am finally at home in Copenhagen. So I am so glad that I made it at least to connect online today. I am quite emotional when it's about Cetic because it has been 20 years, and I have been working with you for the last 15, I will say. So back in the days, in my days when I was working in the Pan American Health Organization, so proud to have been staff in the Pan American Health Organization and also the great work that they are doing now, also in the region. And then I moved to the WHO European region, working for 53 countries in this part of the world. What I could say and what I could emphasize about what is working. So I know that it's gonna sound very selfish, but I think that the two products that Cetic has been involved and that Electra has played a major role to measure digitalization are the gold standard for me when we are talking about best practices and how to measure progress in digital health. The first one that has been already described in 2014, when we came up with these methodological recommendations and how to measure ICT in health. When we were looking at how to, first of all, profile the health facilities, then how to measure the ICT infrastructure, then also looking at the services and applications related to ICT, and finally looking at education and training. So this has been a tool that, again, for me is a gold standard in how countries should work together, right? And in how to measure digital health. It has been a unique effort in which not only the Ministry of Health was involved, but also the National Statistics Office. So I have been trying to promote unsuccessfully this method in the European region, but I still think that is the best way to go. And then later in 2022, again with Cetic and Electra and Aymar and all the colleagues that are seated there today, we developed this monitoring the implementation of digital health when we conducted an overview of what the international organizations are doing about it. And then we were looking at some countries in particular, right? 9 countries. So we saw that in Latin America, Brazil, Costa Rica, and Uruguay are actually implementing these methodological recommendations. And then we saw that other countries, as Denmark, for example, they are very advanced in collecting data. They are focusing on health data portal and how to extract data and measure digitalization based on this health data portal. And then we have other examples as the Netherlands or the Republic of Korea, in which they were more focusing on the hospital level when looking at digitalization. So when we are looking at how we should measure digital health, for me, these are definitely the two tools that should be widely used and that I will still continue promoting across the world because I really believe on them. I would also like to say that everyone when looking at the European region, sometimes there is a misunderstanding about the progress that we have, and I am quite critical about this region because not only 20% of these 53 countries that we are covering are really evaluating digital health. So I think that we can learn a lot from the Americas experience and looking forward to continue promoting this approach. I would like to conclude this question, Luciana and colleagues saying that for decision makers, I think that the most important question with funding these digital solutions and projects, the starting point should be how we're going to measure it. Otherwise, it won't make any sense to work in digitalization if we cannot make the progress. So I think that with these tools, at least we can try to move forward. Thank you.
Thank you, Davi. Anistela, agora é você. Você tem uma ampla
And
experiência,
Estela,
né, em
now this is
políticas
your turn.
públicas na
You
área
have wide
acadêmica, de
experience in
saúde.
public policies,
Gostaria de saber de você como você vê a
education, and
evolução da
health.
saúde
How
digital
do
no
you see
Brasil
the
nesses
evolution of
últimos
digital
anos
health in Brazil
e
over
como
the
as
past
tecnologias
years?
emergentes
And
podem
how
contribuir
can
para melhorar o
emerging
acesso à
technologies
saúde da
contribute to
população?
improve access to health
Obrigada,
by the
Luciana. Muito boa
population?
tarde a todas
Thank
e
you,
todos.
Luciana. Good afternoon to
Luciana,
everyone.
Alexandre Barbosa,
Luciana,
Demiguetsky,
Alexandre,
Renata Miele.
Demiguetsco, Renata
Parabéns
Miele.
pelo CETIC, pelos 20 anos
Congratulations
do
for
CETIC.
Cetic for
É
its 20th
maravilhoso ter o CETIC no
anniversary.
Brasil.
It's
Não consigo
wonderful to
imaginar
have Cetic
não
in
ter o
Brazil.
CETIC.
I
Quero
cannot
também aqui
imagine us not
acompanhar
having it
e
here.
coordenadora científica
So I would like to
precisamente de
compliment the
saúde.
um,
Vocês estão no DNA
scientific
da ciência,
coordinator.
né?
You
Representam
really are
também
on a
a
DNA
Secretaria de
of my
Informação e Saúde
department.
Digital.
Although,
Parabéns por
if it
tudo
weren't
que
for
vocês
you, we
fazem no
wouldn't have the
Brasil. É uma
digital
alegria, uma
health
honra muito grande
information
estar aqui. E
department.
uma
It's a
honra
great
tamanha
honor and a
esses
privilege and a
convidados
joy to be here. It's
internacionais
also
que já
an honor
falaram
to
de
be
manhã.
here with our
Sônia,
international
muito
guests.
interessante. A gente
Sonia,
fala a
very
respeito da
interesting.
conectividade
We
significativa,
talk about
especialmente na região norte do
meaningful
Brasil,
connectivity,
mas como
especially
essa
in the north
história
of
desse
Brazil.
conceito foi
But
muito
knowing how
interessante
the
para mim perceber.
concept was developed
E
was
algumas
very
falas aqui
interesting,
também. Muito
just
brevemente,
as
eu acho que
everybody
tem que contar
else. Very
que no
briefly, I think
Brasil
that we need
nós
to
temos
tell you
um
that in
sistema
Brazil,
público de saúde de
we have a
acesso
public
universal.
healthcare
Eu
system with
fiquei encantada
universal
com a
access.
apresentação do
I
Hospital
was really
Italiano,
charmed
de
with the
tudo que
presentation of the
vocês têm,
Italian
mas a
hospital.
gente tem muito que
In
aprender com
everything, we
vocês,
have a lot
né?
to learn from
No
you.
Brasil, a gente tem um
In
sistema para
Brazil, we
207
have a
milhões de
system
habitantes,
for
né? E a gente está tentando
207
fazer a
million
transformação digital
inhabitants,
desse
and we are
sistema,
trying to
né?
implement the
Nós
digital
temos
transformation
uma
in the
base
system.
que
We have
estruturou e que está estruturando
a
esse
basis
processo.
that's
Nós
structured and
temos
it's
um
structuring this
departamento de
process.
informação
We
informática com
have
30 anos de
uh,
existência, que já
a
criou mais de
30-year-old
400 sistemas de
department
informação. Hoje
of
tem
information.
237
Today we
ativos,
have
que estavam
237
fragmentados. A gente
assets that
tem
were fragmented.
45
We
mil
have
unidades básicas de saúde na atenção primária, 93% delas
47,000
já estão
um,
utilizando o prontuário eletrônico, diversos
units that
prontuários.
are already
Estamos
using the
implementando o
electronic
prontuário
medical
eletrônico,
record. We
tentando
are
implementar um prontuário
trying
já
to
interoperável
implement
com uma
an
arquitetura. Estamos
interoperable
criamos uma
EMR.
arquitetura de
We have
interoperabilidade, que é
created
a
an
Rede Nacional
interoperability
de Dados em Saúde,
architecture in
e
the
estamos tentando fazer
national
tudo isso conversar, né?
health
Tentar
data
construir
system or
em cima
network,
disso um
and we
processo
are trying to
sistêmico,
make
né?
everything
O sistema
interact and
nosso, ele
interface.
é
Our
tripartite,
system is
ele é conduzido pelo nível
has three
federal, em
parties,
parceria com
so
estados e
it is
municípios,
led
né?
by the
Por exemplo, o
federal
estado de São Paulo
government
possui
in
vários RIs,
partnership
governo Marizélia lá,
with
e o governo Conavems,
with the states and
e são
cities.
5.570
And then we
municípios,
have
26
more
estados e
than
capital.
5,000
Então, a transformação digital se
cities
aplica a esse
and
universo, né? Todo
our
mundo
all
tem que
our
caminhar
states
na
and
mesma
the
direção.
capital of the
E
country.
para
So
isso a
everyone
gente
needs to
criou
evolve
um
together.
índice
And for
nacional
this,
de
we have
maturidade da saúde
created
digital, o
a
MAR,
national
os RIs que
index
vem ali,
for
o Antônio
digital
Lira, Sociedade
maturity. And I
Brasileira de
see Antonio
Informática e
Lira
Saúde,
from the
Associação Brasileira de
Brazilian
Serviços de
Society of Health
Telesaúde,
Informatics
foram
and
parceiros,
many
tem muitos
things. They have
parceiros,
all been
CONAF,
partners,
Conselho
lots of
Europas,
partners,
e nós estabelecemos 7
WHO.
dimensões para
We have
esse índice,
defined
para
7 dimensions for
orientar a
that
transformação
index
digital dos
to
estados
guide
e
the digital
municípios,
transformation
desde a
of states and
infraestrutura de rede
cities,
e
from
conectividade, passando
the
pela
network and
infraestrutura,
connectivity infrastructure,
pela
going through
telesaúde, pelos
infrastructure,
sistemas, pela
telehealth,
infoestrutura, pela
systems,
cibersegurança,
infrastructure,
pela proteção de dados,
cybersecurity,
pelo modelo de
data
governança de
protection,
dados, enfim.
the data governance
Estamos
model.
trabalhando
So we
intersetorialmente
are
no governo,
working
participando da
in a
Autoridade Nacional de
multi-stakeholder
Proteção de Dados, levando a
approach
saúde
to
para a
protect
discussão
data,
mais
leading
ampla dentro do
health to a
governo e
broader
com o governo
discussion in
digital
the
também.
government and with the digital
A
government
Secretaria de
too,
Governo Digital tem uma
with
estratégia de governo
the
digital
digital government
que
department
caminha na
with a
direção da
digital
soberania digital e a gente está procurando caminhar
strategy
junto com
that
essa
heads towards digital
iniciativa. Então,
sovereignty, and we are
mais ou menos
trying to evolve
são
along with
esses
that
as
initiative.
questões que a gente
So
está
these are more or less
hoje
the
trabalhando.
issues
Os
that today
desafios
we are
são
working on.
imensos. Aí
The challenges
acabamos
are
de
huge, and we
concluir
have
edital,
just
uma chamada
completed
pública para
a public
universidades
call for
para incluir
universities
o
to
sistema educacional
include
como
the
player
educational
nesse
system
processo.
as a
É um
player
programa de
in this
educação
process.
tutorial
So this
de
is
integração
tutorial
entre
education
universidades e
for
serviços de saúde,
integration
em que
between
grupos
universities and
tutoriais de
healthcare
estudantes,
services, where tutorial groups
professores e
of
profissionais
students,
trabalhem
professors,
juntos em
and
desafios
professionals,
voltados para a
we work
inovação
together
e
to solve challenges related to digital health and innovation. We are going to involve the Federal Institutes of Professional Technological Education, Science and Technology that responds to the Ministry of Education, but this is a very powerful and big network with many institutes in Brazil, but we want to take to them the health agenda and also to interface with the private sector. So this is all the issues that in these 2 years, ever since the creation of the Digital Health Information Department, I see João Paulo from Bireme, decision making. There are many different strategies to try and converse with users. And the National Network of Health Data has 3 interfaces, and one very important interface is MySUS Digital, which is the citizen's app of interactions with the health system. There they have access to their health information, the main data, and there are many different programs and actions, education for health. So this is a little bit of what Brazil is trying to do, and we can only do that because we have adopted in 1988 in the federal constitution among the very brave constituent representatives to have a universal access health system in a country as big as Brazil.
Obrigada, Anistela.
Thank you so
Bom,
much,
agora a pergunta para
Anistela.
Eymar.
Now I have a question to Eymar.
Tem sido
Eymar,
fundamental sua contribuição
you
para a pesquisa
have
de saúde desde o
provided
início, né?
fundamental
Você é
contribution
a
to health
coordenadora
research,
científica da
and you
pesquisa
have been the
e um dos
scientific
públicos que a
coordinator of
gente
research
investiga
since the
são os
beginning, and
médicos
one
e
of the
enfermeiros.
audiences that we
E você está
research
muito
are
envolvido
doctors
também,
and
né,
nurses,
com
and
essa,
you're very much involved
com esse setor dentro da saúde digital.
with that
Então,
sector in
queria
digital health.
perguntar para você que as
I
evidências
would like to
produzidas no
ask
Brasil
you, the evidence
mostram a
produced in
falta de
Brazil
habilidades
show
digitais
the
entre os
lack of
profissionais de saúde está entre os
digital
principais
skills
desafios para o
among
avanço da
healthcare
saúde
workers is
digital.
one of the
Então, como
main
você enxerga o
hurdles
futuro das
for the
políticas
advancement
públicas
of
nesse
digital health.
campo?
How do you see public policies
Bom,
in
em
this
primeiro
field and
lugar,
the future?
vocês não têm
Well, first
noção
of
do
all,
orgulho que eu
you
tenho
have
de
no
pertencer a esse
idea how
grupo,
proud I
né?
am to be
E eu
part
devo
of
isso a
this
Paulo
group.
Otero,
And I owe
né?
this to
Porque foi a
Paulo
Paula
Otero
que falou
because
da minha
Paula
existência para o Alexandre
told
lá
Alexandre
em
about
2011,
me way back
né?
when
Foi a
in
Paula Otero
2011.
do
It
Hospital
was
Italiano
Paula
de Buenos
Otero
Aires
from the
que falou:
Italian
não, você vai
Hospital
fazer
of
alguma
Buenos
coisa
Aires
em
and said,
saúde e
so
tecnologia, tem que
if
falar
you're
com o
going to
professor
do
Eymar.
something
Aí lá foram
with
Fábio
health and
e
technology, you
Alexandre
need to
falar
talk to
comigo na
Aymar and
Unifesp.
Fabio
E
Alexandre, who
de
came
lá
to talk to me at
começou a
Unifesp,
nossa
and
trajetória.
then we started
Então,
our
assim, é muito
trajectory.
orgulho, é um
Um,
trabalho
we are
muito,
very proud.
muito
This is
robusto,
very
conduzido pelo
robust
Cetic.
work
Vocês viram
conducted by
isso.
Cetic.
O
You've seen
Marcelo
that
Pita, como
Marcelo Peter,
estatístico,
as a
nos conduzindo numa
statistician,
metodologia.
leading
Então,
us in a
é óbvio
methodology.
que eu só
So
posso ter
obviously,
enorme
I can
gratidão ao
only be
Cetic nesses
deeply
20
grateful
anos
to
que eu estou
Cetic
desde
in these 20
2012,
years. I have been since 2012
conduzindo a pesquisa
leading
TIC Saúde, porque
Take
cada
Health
pergunta que a
research,
gente
because for
inclui
every
tem que ter
question
uma
that we
análise
include,
enorme.
there has to be huge
E
analysis.
todo mundo,
And
até
everyone,
a doutora Anistela me chama de professor Eymar, quer
even
dizer, todo mundo me
Dr.
chama de
Anistela
professor
calls me
Eymar,
Professor Aymar,
porque
Professor
a minha
Aymar.
trajetória
Well,
toda foi
because my
numa
entire
instituição pública
trajectory has
federal,
been
na
at a federal
formação de
public
profissionais na
organization,
área de informática
teaching
em
and
saúde,
training
desde que eu comecei.
professionals
A
in health
minha tese de
informatics ever since
doutorado
I started. My PhD
foi em
thesis
inteligência
was
artificial
in
usando base de
artificial
conhecimento,
intelligence
porque era o que nós
using
tínhamos em
the knowledge
1900
base, but
e
because
pouco.
this is what we had in the 1900s.
E o que nós percebemos é que
And what
naquela
we
época,
saw
na
is that
década
back
de
then,
80, 90,
in the 1980s and
nós tivemos
1990s, we had
nós já fomos pioneiros em muita
we
coisa
have
no
been
Brasil,
pioneers
na
in many
questão
things
de
in Brazil
formação de
in
profissionais.
terms of
Nós tínhamos
professional education.
departamentos em quase
We had
todas as
departments in
universidades.
almost
Estou vendo
all
aqui a Cláudia Moro
universities. I
tem,
can see
a
Claudia
Grace,
Moro,
a Escola de Enfermagem da
Graci,
USP,
the
doutora
School of
Heloísa.
Nursing of the
Nós tínhamos
University of São Paulo.
escolas com
We had
formação
schools with
de
training
profissionais, médicos e doutores, na Unifesp, para
and then
enfermagem, era uma
training
disciplina
doctors and
curricular.
nurses. In
Não
nurses,
era
it was was
fora
part
do
of the
currículo.
syllabus. It
Isso eu
was not
coloquei em
something extra.
1990.
And this was in
Para
1990.
medicina,
For
era uma disciplina
medicine, it
optativa.
was an optative
A
subject.
escola de medicina da USP
In the School of
tinha
Medicine of the
residência
University of
de
São Paulo
informática
had
médica. Foi
a
a primeira
residency of
residência
medical
antes do
informatics.
Hospital
It was
Italiano,
the
a primeira
first
residência de
residency
informática
before
médica
the
no país.
Italian hospital,
Hoje,
the first one in the country. And
quem foi
today,
formado
those who
por
were
esta
trained
residência
in
está nos
that residency,
melhores
they are
topos
at the top
da vida e da decisão em
of
informática e saúde no
life
Brasil e fora
and
do Brasil,
decision making
porque
in health
também
informatics
perdemos
in
muitos
Brazil and
talentos
also
por
overseas
não
because there
investir.
has been a
E de
talent
repente nós caímos
flight because
num
we didn't
vazio.
invest.
Os
And
cursos de
then we
mestrado
felt
estão
in an
fechando, os cursos de
emptiness.
doutorado estão fechando,
Masters,
nós não
the
temos quase
programs and
disciplinas
PhD programs
mais.
are closing. You
Nós
hardly ever
caímos
have
aí
any
num vácuo
subjects.
enorme e a
And then
pesquisa
we
de
were
saúde, o
in a
Marcelo, não sei onde é que
huge
ele tá, mas,
vacuum.
tá
And
lá
I
em
know
cima.
where
De vez em
Marcelo
quando ele
is.
fala para mim,
Sometimes he says to
não tem
me,
resposta significativa. Eu falei, mas vai
well, there is
manter a
no
pergunta.
significant answer. Well, I say, keep the
Porque
question.
eu preciso
Because
saber. Eu sou
I need
taurina.
to
A
know.
Ana Estela também é. Então a gente fica nisso.
So we
Nós
insist very much on
precisamos
things,
saber onde
myself
está a
and Estela.
formação e como
We need
anda
to
a
know
formação.
where
Sem
education
medir,
is.
que é o que a TIC Saúde faz. Nós não
And
damos
this is
nome e
what
nós não
TIC Health
fazemos
does,
políticas de
or
Estado.
ICT Health. We
Podemos
don't
fazer
name
políticas
names
de
and we
governo,
have no
mas não fazemos políticas de
state
Estado.
policies. We may
Se não
design
tivermos
government policies.
profissionais
If we do
capacitados,
not have
nós não
well-trained
conseguimos
professionals,
implantar.
we
O
will
Daniel
not be
colocou
able to
isso.
implement.
Eu estou
Daniel
vendo o
said
Dr.
that.
Lira
And I
no
can see
congresso de
Dr. Lira
22 da
in
QBIS.
the
A
Congress
gente
in
montou uma matriz de
2022.
competências,
We built a
né?
matrix of
E essa
competencies.
matriz de
And
competências,
this matrix of
ela foi
competencies,
divulgada,
it was
foi
published,
revisada, não foi intentada.
reviewed.
Nós nos baseamos de todo. Eu
We
tenho
did.
papel também. Eu sou
We didn't
presidente da
invent it.
Academia
I'm also
Mundial de
president of
Informática e
the World
Saúde da
Academy of Health
Associação Médica.
Informatics of the
É só
Medical
velhinha que tem, eu
Association.
sou a mais nova
It's
lá.
only old people. I am the youngest one there.
Mas são os fundadores.
But
Só não tem
they
François
are the
Gremy e
founders.
Maurice Collin, porque
Only
faleceram há alguns
François
anos.
Gremy and Maurice Collin are
Mas
not
a
there because they
academia
died.
também
But
enxerga isso. Quer
the
dizer, a
academy
Europa também
also
sofre
sees
com
that.
isso,
Europe
com a falta de
also
profissionais.
suffers with that,
Estados
with a
Unidos
lack of
menos, porque o
professionals.
Donald
The
Lindenberg,
US
da
not so
National
much
Library of
because
Medicine,
Donald
ele
Lindenberg with the National
decidiu
Library of
que todas
Medicine
as escolas de
decided that
saúde
all
teriam um pequeno
health schools
departamento de
should
informática em
have
saúde.
a health
Então,
informatics
todos vocês
department.
veem
So
Harvard,
all of you,
Yale,
Harvard, Yale,
Columbia,
Columbia,
Oregon, quase
Oregon,
todas as universidades.
almost
Que foi a
all
visão que o
universities
hospital
have that,
italiano teve.
which was the vision that the Italian
Queremos
hospital
implementar,
had.
vamos fazer
We want
residência em
to
informática
implement,
médica e
let's do it, let's have a
colocar.
medical informatics residence
E
program.
nós estamos com esse vácuo profissional.
And we
que a
have this
pesquisa de saúde está
professional
mostrando
vacuum
isto.
that
Hoje eu vi no
research
jornal
is
que
showing.
tem,
Today I saw in the newspaper that
a semana passada, eu estava até conversando com o Demi. Nós
just last
temos
week,
aí
and I
a
was talking to
população
Demi,
analfabeta funcional.
we have
E
the
23%
functional illiterate
analfabeto
population, and
digital no Brasil.
23% of them are digital
Só 23%
illiterate population.
conseguem entender
Only
pouco de digital.
23%
Então,
can
o nosso
understand a little
índice
bit.
de analfabetismo é muito
So
alto.
our rate
Então, a
of
gente tem
illiteracy is
muito
very
trabalho
high.
pela
Only
frente.
23%
E eu
of the population
gostaria muito
can understand. They are
que
literate.
governos,
So I would like very much governments, developers, stakeholders, state
usassem mais
to
os dados que nós
use more
produzimos na
the
TIC
data
Saúde.
that we produce
Porque eles
at
são dados
ICT Health,
criados com uma
because they are data
metodologia muito
created
robusta.
with a very robust
Então,
methodology.
esses dados,
So the
eles
data
existem para a formação de
exist
políticas públicas. Eles existem
to
não
build,
é só
to
para fazer
feed into
pesquisa na
public
academia,
policies. It's not
é
just for
também para a
research
formação de
in
políticas
universities.
públicas.
It's
E é
also
isso
to
que eu
be the
gostaria
basis
de
and
ver
to
um
feed into
pouco
public
mais. Eu
policies.
acho que
And this is what I
tanto
would
de
like to
dados que
see a
nós
little bit more.
coletamos nesses
We collect
12
so
anos,
much data
a
and we have
utilização
collected so
ainda é
much data over
tímida
12 years
pelos que
that
desenvolvem.
we are
Eu
using
não
it
sei se é
very
pouco
little by the
de... A
ones
minha sobrinha fala
developing.
como é que é?
My niece says, I don't know whether
Autismo
this is
social.
something social
Né?
autistic.
Quer dizer, não estou enxergando o que
So
o mundo está
I can't
acontecendo
see
e eu
what
vou
the
desenvolver
world
aquilo que eu acho
is
legal. O
seeing,
Daniel
and
chamou
I
a
will do
atenção para isso.
whatever I find
É um
nice,
esforço
the
muito
things that I
grande
like. It's
para
major effort
pouca utilização.
for little use. So if we don't look and we can see the barriers and you can see what they use, nurses and doctors. Daniel also said this. It's the means, it's not the end. The end is to provide better care to the population, as Dr. Ana Estela pointed.
Obrigada, Aymar.
Thank you so
Daniel,
much, Aymar.
agora para você.
Daniel, now
Mais
question to
aí
you.
direcionada à IA. À medida que a
More
inteligência
directed to
artificial se
AI.
torna mais
As
integrada às
AI
práticas de
becomes
saúde,
more
o que
integrated to
pode ser
health
feito para
practices,
proteger os dados
what
do
can be
paciente e
done to
garantir
protect
privacidade,
patient data to
especialmente no
assure the
contexto dos
privacy,
países da América
especially in Latin America?
Creo que es un gran desafío. El problema
I believe this is a major
parte por una
challenge.
concepción social
The problem
organizacional.
that is based
Obviamente que el
on
concepto
social
tecnológico
concept.
es
Of
una
course, the
problemática que va
concept
a ir
of technology
incrementando
is a
porque, como lo
problem
dije en
that
la exposición,
increases.
hoy es un negocio
So
tema de la seguridad.
it's a business,
Pero yo creo
security
que
is
tiene
a
que ver más
business,
con
but I believe
actitudes
this is more related
socioorganizacionales.
to
Los
socio-organizational
pacientes
behaviors.
normalmente tienen datos
Patients
privados,
usually have
son privados
private data,
porque
and they are private
son propios y no quiere
because
que lo conozca
they
nadie.
are their
En el
own
momento que el
and they don't need to
paciente
show to
va a
anyone.
consultar a
So if the
un
patient
profesional
goes
de la
to an
salud,
appointment to a
otorga,
healthcare
rompe esa
worker,
privacidad y la
they
convierte en
give part of
confidencial.
this
Es
privacy
decir, se lo
because
dice
they
a
believe
alguien
it
para
is
que quede
confidential.
entre ellos dos.
So
Y luego aparece el concepto de la
and then there
seguridad,
is the
que es lo que tiene
concept
que dar
of security, and
una
this
suerte de protección a esa
needs
confidencialidad.
to
Voy
provide
a dar un
some
ejemplo.
protection to secrecy.
En mi
For
hospital,
example,
cuando
in my
un
hospital, when
paciente que es
a
expuesto públicamente
patient
se
who
interna,
is publicly
automáticamente tiene
a
un
celebrity
aumento del
that is
100% de
admitted,
accesos a
there
esa
is a
historia clínica.
100% increase of access
Entonces,
to
no es un problema
his
tecnológico,
history.
es un
This is
problema
not a
social,
problem of technology. This is a
porque
social problem
tenemos que buscar
because
modelos para
we
tratar de
need to
educar y
find
entender
models
que
to
cuando
try
uno va en el
and
auto y
teach and
pasa un
understand.
semáforo en rojo,
If someone
sabe qué es lo que está
goes through
haciendo
the red
y
lights, they
luego
know
tiene que
what they're
atenerse a
doing,
un
and
accidente
then
o a una
there was
multa.
an accident or
Cuando
will
un
get a
profesional de la
fine.
salud ingresa
When a
un usuario
healthcare
clínico
worker is
y el
interested in
paciente
the
todavía
health
no está
history
bajo
of
su
a
atención
patient that
profesional,
they are not providing
sabe que lo
care,
está haciendo y tiene
they
que
know
atenerse a un
that
problema
they
específico o a una
shouldn't do
sanción.
it.
Y uno de los puntos más importantes es
So one of
empezar a
the
crear
most
cultura.
important things
De nuevo,
is
el
the
mismo aspecto.
culture.
La tecnología
Once
va a ir
again, it's the
cambiando
same
y
aspect.
lo que tenemos que trabajar
Technology
es en la
changes, but we need
instancia
to
y en la instancia
work
cultural. Es decir, un plan
on
de seguridad
culture.
tiene que tener un
So
plan de educación.
security
Y
is
es muy
related
difícil
to
porque
a plan of
normalmente
education.
se
It's very
subestima la
difficult because
importancia del
usually we
dato sensible. Y la
underestimate
inteligencia
the
artificial llega
importance of
como
culture.
un arma de doble
AI
filo. Puede ayudar, puede
is a
darnos la
double-edged
inferencia de
sword. It
ingresos no
may
autorizados
help
a la información,
to
puede darnos
provide
nuevos
access to
mecanismos para
information,
la
may provide
detección
us
de
new
amenazas,
mechanisms
pero también
to
puede generar
handle
lo
threats,
inverso.
but it may
Pueden
also
generar
cause
nuevas
the
herramientas
opposite.
para poder acceder a
New
información sensible
tools to
porque
have
siempre va a haber
access
alguien
to
que va a
sensitive
tratar de
information because there's
conseguirla para
always
lucrar por
someone
ello y
who
utilizarlo de forma
will try
maliciosa.
and get it to use it in a way that is not appropriate.
Bom, agora vamos abrir para
Well,
perguntas.
now we are going to open for
Alguém tem
questions from the audience. Anyone has a
Vamos
question?
fazer
And we are
três
going
perguntas, tá?
to
Pelo
allow
que tem ali
3
também no
questions.
Não consigo ver direito pela luz.
Boa
mas-
I
tarde,
can't really see
sou
because
Leonardo
of the light.
Tis, do
Good
IBGE, que é o órgão
afternoon.
oficial de estatística
I
do Brasil.
am
Tenho uma pergunta
Leonardo Tis
mais
from the
específica para o
IBG,
Daniel,
the
e outra
Brazilian
que vai para todos, né?
Statistics
Já falou nessa
Organization. A
questão
question to
da
Daniel.
confidencialidade,
You
né? Mas
mentioned
se eu entendi
about
corretamente,
secrecy.
vocês usam um
If
modelo
I
de
understood,
linguagem,
you
que é um
have
modelo
a language model
comprado, mas é um modelo
that
que é fechado, digamos assim, né?
is
Que não
that you
faz
bought, but it's
intercâmbio de
closed.
informações, né? De
It doesn't
estudos ou de
exchange
prontuários que se tem
information
no sistema
of
do,
your studies
do
and
hospital
records
com o
in the
provedor, né?
hospital with
Aí
a
eu fico com a
provider.
pergunta,
And then I wonder,
teria, quer dizer, eu trabalho com estatística mais com
I work with
conexão de dados, né? Data
statistics with
linkage,
data
isso a gente pensa,
connection,
a que
data
ponto não seria,
linkage, and
não
we
tem uma
think,
maneira de anonimizar isso para se
couldn't
ganhar
we
volume ou para
make the data
intercambiar
anonymous
com
to
outras
gain volume
instâncias, né?
and
Se não
to
vai se perdendo
exchange with other
uma
instances?
oportunidade nisso,
And you
que está
might be
acontecendo. E outra
missing an
pergunta um pouquinho mais
opportunity
específica que é,
uh,
assim, se a barreira de
and the
trabalhar
other
com
question is the
espanhol, né, nesse
barrier
caso,
of
ou com
working
português, se
with
isso ainda é
Spanish or Portuguese.
ainda é um
Is it
problema, né,
still
com
a
ferramentas que
problem?
são criadas muitas vezes,
with
né,
tools that
para inglês.
oftentimes are
Essa
created
pergunta. E
to
para o
work
painel,
in
quer dizer,
English.
tem a ver com essa
So,
questão,
and
né?
for the panel, it's
O painel
related
já
to
deu a
this
ideia da
issue.
formação, né?
Daniel
Mas a gente sabe que o
gave us the
profissional, ele
idea of
vai
education,
querer
and
resolver o
we
problema
know that
dele. O
professionals, they
burocrata, o
want to
médico,
solve
né,
their
provavelmente vai usar um
problems.
sistema, né,
Doctors,
que
they
ele
have
tem
a
ali, né, o
system
ChatGPT,
that
o
they
Claude
have,
e tal,
chat
vai colocar uma
GPT, the
informação
cloud, they're going to enter
confidencial, né,
information
enfim,
that is
e alguma coisa
secret,
vai sair ou vai
and
acontecer, né? Como é
something
que a
is going
gente
to come
trabalha
out
para
or
isso? Será que
happen. How can
precisa da
we work?
ferramenta? Ou é só uma questão de
Do you
cultura, né?
need to
Como é que
have
a
a
gente resolve,
tool?
né?
Is it
Que
just a
a
matter of
inteligência não seja degenerativa, né?
culture?
Como você está falando agora, de maneira que a
And
gente consiga
then
que se tenha
we
mais
can,
responsabilidade, né, no uso, que essa é uma das grandes preocupações que todos nós temos aí com essa evolução.
and then this is
Obrigado.
something that we have.
Vamos acho que fazer uma rodada e depois
We have a
responde.
round, and then
Mais?
each one will answer. Do you have more?
Obrigada. Boa tarde a todos e
Thank you
todas.
so
Meu nome é
much.
Raquel,
Good
sou pesquisadora
afternoon,
colaboratória
everyone.
de
My name
políticas
is
públicas e
Raquel.
internet pela
I
PUC.
work in the
Também
Public
compõe o
Policies
Laboratório
Lab
de
in the
Saúde Digital do
Internet.
Conselho Nacional de
I'm
Saúde.
also
É
a
muito interessante ouvir
digital
as
health
falas, aqui
technician
agradecê-las.
at the National Council of
E
Health. Thank you
queria,
so
enfim,
much
ir um
for
pouco
everything that you
pelo
said.
caminho de a gente pensar a
So,
questão da saúde digital para além dos
if we think
equipamentos
of
de
digital
saúde,
health
olhando para os
beyond
sistemas de
healthcare
saúde, principalmente os
facilities, looking
públicos,
into healthcare
pensar
systems,
que
especially
na nossa
public
experiência aqui
healthcare
no
systems, and
Brasil
to
e a
think that
experiência
our
mais
experience
licenciada
in
é
Brazil
um pouco
and
distante daquilo
is kind
que
of distant
segue em curso na Europa,
from what is
e
going on in
também
Europe.
pensar esse tema um pouco para além
And
do que
to
normalmente se
think about
fala, no
this theme
sentido mais específico e estrito da proteção dos dados
and more
pessoais.
strictly in terms of the
Eu queria
protection of
aproveitar
personal
o
data.
momento para fazer uma pergunta para a
And I would
professora
like to
Estela,
take the
secretária
time to
Estela,
ask a
né,
question
sobre o
to
conceito, não necessariamente o conceito, mas como que
Secretary
a
Ana
CEPIG
Stella
observa
about the
o
concept
tema da
and how do
soberania
you see the themes of the
digital em
digital
face do
sovereignty
plano anunciado pelo Ministério
considering
da
the plan that
Fazenda para a
has been
atração de data
announced
centers aqui no Brasil
by the plan
e,
of
enfim,
the Ministry of
agradecemos
Finance to
novamente a
attract data
compreensão. Obrigada.
centers to Brazil, and thank you so much.
Messi.
Bom, boa tarde a todos. Parabéns
Good
ao
afternoon.
CETIC
Congratulations
pelos 20
to
anos e
Cetic
por tudo
for
que
your
fizeram na área
20th
da saúde
anniversary
também.
and everything that you have
A
done in
pergunta
the
é a
area of
seguinte,
healthcare
também
too.
no internacional, lá para o
So
Davi Novilho,
also
para
at
representar a
international
OECD,
level,
nós tivemos uma
Davi
grata
Novilho,
satisfação com a experiência
representative
da
of
Anastela de ser
OECD, with
criada
Anastella
a CEIPIG,
experience
a Secretaria de
of
Informação e Saúde
the
Digital no
creation
Brasil, que
of
pelo
the
menos há algum
Department
tempo
of Digital
atrás
Health
era a
in
única
Brazil.
na América
At least it
Latina.
was the only one in
Então é uma
Latin America
pergunta
until
para
some time ago.
vocês, né,
So this is a question
da
to you
OECD e
at
da
OECD
OMS, Davi,
and
se isso vem
WHO,
sendo criado
David,
a
whether
nível
this
nacional,
is
né, em
being
outros
created at
países,
national
e
level in
essa
other
é uma
countries,
política pública que
and
com
is
o
this a public
lançamento do
policy
SUS
that
digital
as the
100%
launch
aceito
of the
pelos
digital SUS
municípios brasileiros e
100%
pelos
accepted by
estados
Brazilian
brasileiros, já
municipalities and
acarreta
Brazilian
aí
states
uma consequência
already
enorme
has
de uma
huge
implantação
consequences
que
for
é um
the
requisito agora
implementation
para o
that is
Brasil, né?
now a
Que as
requirement
bases já
for
estão
Brazil,
lançadas.
and the bases are there.
Obrigada. Eu vou também só complementar aqui e depois passar para vocês responderem.
I
Mas
just
também
like
queria
to add
ouvir
a few
de vocês
comments.
quais devem ser as
And my
prioridades
question
em
is,
relação ao
what should be
desenvolvimento
the
das novas
priorities as
tecnologias
to the
emergentes
development and
para as
adoption
políticas
of emergent
públicas para superar os
technologies for
desafios e
public
garantir acesso
policies
equitativo
to
à saúde?
surpass challenges
Eu
and
vou
to
dar 2
guarantee
minutinhos para
equity in
cada um
health?
responder e peço
You're going to
para que
have 2
vocês já
minutes each,
façam uma finalização, um
and
fechamento na
also, you
de 6
know,
minutinhos e nós nos falamos
benefit
no
from the
final da
closing
nossa
remarks because
primeira
it's
Electra.
4 o'clock. We are running a bit late. Thank you, Electra. You are the first.
So, sorry, is it the question that was just put in terms of digital health in Brazil or your question on equity?
Yeah.
Yes, I think.
And the one that you could see in other countries, if there is like a secretary or some kind of what ministries of health are doing in digital health.
Well, there's been in the last 20 years an enormous progress in terms of governance of digital health and ministries being creating agencies involved not only in managing digital health implementation and ICT's implementation, but also now artificial intelligence. So there is enormous commitment. We can see it across all countries, be it at OECD level or WHO level. So there is a significant, as I said, already back in 15 years ago, there was enormous public investment in digital health infrastructure with the creation of systems in place with responsible ministries behind. So we're talking about public investment. Clearly, we started off with private investment, but there has been significant public investment in this area with agencies and ministry level involved in all of this and following. And at OECD level, we worked with governments. All of the questionnaires and surveys were sent to governments and ministries. So if that replies or answers that. And as I said, I think that really the frontier now is to address equity. We heard about meaningful connectivity. We need to think about meaningful use as well. There is a concern that with artificial intelligence, we're going to layer on further inequities. And this needs to be measured and needs to be assessed. So we need good indicators for equity and follow up, not only in terms of connectivity, but access and how patients in rural areas with different socioeconomic conditions, different demographics, access and are able to use digital health and artificial intelligence. And we know from what we heard this afternoon that the problems are there, and we should not underestimate the risk of creating a new and more important divide with AI. And I hope this answers your question.
Thank you. Ana Estela, por favor. Desculpa, pode ser o Davi, que está online. Davi Novilho, por favor.
Davi, you are online. Can you please answer?
Stella can go ahead. I don't have any problem. Luciana, do you want me to?
Não quer falar? Não quer?
Oh, no. I can go ahead. It's like I don't know the order of the speakers, so should I go ahead?
No, you have the floor, Davi.
Okay. Yeah. So first of all, sorry for this personal joke, but I just saw Luisari Messina, and Luisari, you need to tell us how you can make it every day even younger. I mean, we have met for 15 years now, and yeah, what to say? Really good to see you, my dear friend. So I would like to touch in two of the questions. The first one about from the colleague talking about if this is about culture, etc. For me, it's definitely about culture. This is something that should be done, as Daniel mentioned also. And for me, this culture should come from the university, right? We can try to develop trainings, programs, etc., but the root problem is in the academia. So we really need to include this in the academia, in the curriculum of the health science, to really make a change. And I am so glad to see that in the Americas region, this is already happening, because that is the key for success. And then about equity, Luciana, about your question, just to mention that there is not a good recipe for solving equity when it's about digitalization, but there are 3 recommendations that from WHO we are all the time suggesting to our member states. The first one is that we need to have a common framework to monitor and report inequalities. And that is something that, at least from WHO, we are trying to develop at the moment to support countries in that effort. The second is to map inequalities in digital infrastructure. And for this, the tools that Cetic have developed are key to really map these digital infrastructure inequalities. And finally, and most important, I would say that it's extremely important that we have an inclusive and participatory approach when designing technology. I think that Daniel also mentioned this when talking about electronic health records. We neglected a bit the participation of the health workforce in developing digital solutions, and now is perfect time to revert that back and to really put the health workforce at the forefront of developing and designing solutions. Thank you.
Obrigada, Davi. Ana Estela. Como que em termos de tecnologias emergentes,
As to emergent technologies, How can technologies being developed and adopted to
Bom, acho
foster
que o
equity?
Babé trouxe questões interessantes. Eu não sabia que depois que eu vi que o Messina estava aqui, então
I
queria
didn't
dizer
know that
que a
Messina was in the
Universidade Messina
premises. The
também
telehealth
é
university
muito importante no
network
Brasil,
is another very
na saúde
important player
digital,
in Brazil for
e
digital
está
health.
também no DNA da CEDIG.
And that is also in the DNA of CENID.
E eu acho que é
Cetic, I
muito
mean.
importante essa pergunta que você traz, Luciana, eu acho que ela dialoga muito
Your
com
question
algumas
is very
questões que
timely
o Daniel nos
because
trouxe como
it
questões
addresses
aprendidas também.
some
Eu
other
acho que
lessons
sempre
learned given by
existe
Daniel
um
here.
mito
There is a
da
myth
tecnologia. A gente, às vezes, é muito
of
seduzido
technology. We
e
are
as
highly
tecnologias vão
seduced by
mudando e
technology,
aquele
but
mistério que
technology
você vai
keep
correndo atrás
changing, and that
é
represents a
o momento
mystery
muito
that you
crítico
go
das
after and
tecnologias,
after.
entender
Therefore, a
criticamente,
critical understanding of
saber colocar no
technologies
nosso
to really
contexto,
understand what they
né?
do, how they can be
E
applied
saber qual é o
in our
nosso propósito com
context,
a
and to know
tecnologia
what
é
our purpose
fundamental.
with
Ela é um meio,
technology
ela
is.
não é
That is
o
a
fim em si
means, that
mesmo,
is
né?
not
Então, às vezes a
the
gente pode se
end.
perder na
So
inteligência
we might
artificial, por
get
exemplo, por
lost
não
with
compreendê-la
artificial
completamente,
intelligence,
porque ela vai
probably
mudando
because we
mais
do not
rápido que
fully
o nosso
understand
entendimento
it,
alcança,
as
e
it
quando a gente
keeps changing
alcança
much
um modelo,
faster
outros já
than we are
chegam,
able
e
to
a gente
understand it.
fica
Once we are able to
ali
acquire one model, that model is no
sem essa
longer in place, that
capacidade
there is
também, né?
something
Então, eu acho que a
else
gente está
new, and we
num
have to
esforço
run
na
to learn
CEDIG, não
about
dá para
that.
trazer tudo em
So
10 minutos,
we
mas a gente
cannot,
vem num esforço
at
de construir
our
um
my
mapa teórico
agency or
crítico também
entity,
para a saúde
we are
digital,
designing a
à luz
critical,
da reforma sanitária
theoretical
brasileira, à luz do Sistema Único de Saúde,
framework
que tem como um princípio
considering
a
the
equidade e
unified
a
health
transversalidade de
system,
acesso,
which
e sem
looks
dúvida nenhuma a
after
inteligência artificial
equity
traz um
and
desafio muito
access
grande,
to
não é?
all. And
Que
artificial
é conhecer os
intelligence
bancos, conhecer
represents
os
a
dados que a
challenge,
gente está
which is to
usando,
learn more about
conhecer
banks, data.
tem várias formas de você
There are
manipular a
different ways
opinião
as you may
pública.
manipulate
Ela,
the
como
public
negócio, vem sendo
opinion,
manipulada
and as a
em vários
business that has been manipulated at
aspectos, né?
different levels.
Então, tem a oportunidade e tem os
So
riscos. A
there
gente
is an
precisa conhecer
opportunity
ambos
and there
e
are
trabalhar
risks.
no
We have
sentido de
to
tirar o melhor
know
de tudo
both
isso, né? A
and to
gente
take
vê
the
que no
best
G20,
out of that.
Electra me
During
falou,
G20,
perguntou sobre o G20
Electra
na
has
saúde,
asked me
e
during
nós
lunch
tivemos a
about
presença do Sir
G20
Michael
in
Marmot,
health, and we had
trouxe
Sir Michael
determinantes sociais da
Marmot,
saúde
which addressed the social
níveis muito altos de
determinants of
inteligência
health
artificial na
in one
saúde,
of
né?
the AI
E a pergunta
seminars
dele
that
para
we
a gente
had,
na abertura do
and his
seminário é: ah, que
question
bom que agora tem
at
inteligência
the opening
artificial.
session was,
Mas a
how
pergunta é:
great
quem
that
está
now
no
we have
controle?
AI.
Então,
But the
acho que a gente
question
tem que
to be
perguntar
asked
quem
should
está no
be,
controle,
who
né? E
is
nesse
under
sentido, a
control?
soberania digital
And
é
digital
um princípio
sovereignty,
também
it became
desse governo, não
a
tenho dúvida
principle
nenhuma, não
of
só
this
do Ministério da
government,
Saúde. Eu
not
não falo
only
pelo nosso
health
governo, eu falo
ministry.
pela
I
Secretaria de
am
Informação
talking
Digital, mas
for
posso
the
dizer pela
digital
CEPEM
health
que é um princípio do
agency,
governo. Estou
but I
muito
may
feliz de
say
estar
that,
aqui,
it's
parabenizo mais uma
also a
vez,
way to include
uma
the
honra
government.
e um
I'm
imenso
very glad
aprendizado,
to
como
be here.
sempre,
It's an
aprendo com
honor,
vocês.
great
Parabéns, muito
learning to
obrigada.
hear you all. Thank you.
Eymar.
Bom, eu acho que
Well,
equidade você alcança quando
equity
você tem uma
may
população
be
totalmente
reached
educada,
if you have a
digitalmente e
well-educated
funcionalmente,
population,
literacia
digitally
funcionalmente e
and
digitalmente.
functionally.
Então, de novo, né, doutor Lee,
So
nós
once
estamos
again,
mais tentando
here we
formar
are once again
pessoas para
trying
fazer isso. A
to
inteligência
have
artificial,
people ready for
eu
that.
acho importante
Artificial intelligence.
o que o Daniel colocou.
I
O
like
uso
what Daniel said,
responsável,
responsible
alguns
use of
artigos,
AI.
tem dois artigos, se alguém está
There are
interessado
two
em inteligência
articles. If you are
artificial,
more
tem dois
interested in
artigos muito
learning about
interessantes.
AI, there are two very
Acho que foi
interesting
publicado na
articles to be
Lancet
read. One of them
Digital. Ele
published
fez
at
o
Lancet
teste de
Digital.
Turing. Todo mundo sabe
The
quem foi
Turing
Turing, né?
test. Do you know who
Ele
Turing
fez o teste
was?
de
He
Turing
performed
com
the
esses
Turing
modelos de
test
linguagem, com
with the
todos.
language
Pegou
models,
Llama,
with
ChatGPT,
LLMs. Llama,
Claude, pegou
ChatGPT,
vários.
Cloud, you name it.
Só dois passaram no teste de
Just
Turing.
two
O
have passed the
ChatGPT
Turing test,
4.5 e o
ChatGPT
Llama. Os
4.5
outros
and
não
Llama.
passaram no teste
All
de
others
Turing.
have failed
O
at
teste não é
Turing
perfeito?
test.
Óbvio
The
que não
test
é.
is not perfect. Of
Certo? É um
course, it's
modelo de
not. It's
avaliação,
just
mas
an
é uma boa
assessment
referência
model.
que nós
But
temos.
anyhow, it works as a
Outros
reference. Others, conversely, are still trying to understand what the main challenges are. And the challenges are on the responsible and ethical use.
Como é desafiador a implementação.
Implementation can be so challenging. I don't know if you see during Daniel's presentations about external validation, models external validations.
Eu pedi pro meu povo lá da revista.
I asked my staff at the International Journal of Medical Informatics to summarize this information. From 2018 to 2025, with the keywords artificial intelligence, machine learning, and deep learning. With these keywords, I got 13,924 articles. How many have I published? 1,500. Out of those 90,000. Why? Because it does not get out of the model. It does not skip from the algorithm performance model. And who develops the algorithm just wants to prove that your algorithm is better than others. Few of them, they have the ability to understand mine does not work. I'm going to stop it here and I will adopt another one. There are very interesting articles that you can check with the reference, but yet as to AI, we have much more to learn. Daniel and John Halanka talks more about that, which is costs. How much it costs to develop, to test, and to implement an AI model. John Halanka from the Mayo Clinic said that goes around $4 million from the very beginning until the final implementation. And we are not assessing, evaluating. I mean, we still have much more to learn and to do with AI. Demi talks about the Shakespeare idea of the... I'm just going to make a parallel of it. Alexander is an excellent cooker, but the fire helps to heat us to cook, but it may also burn everything which is surround us. So it's a way of using it and to know how to use the hammer.
Obrigada, Daniel.
Antes de contestar, quiero hacer dos reflexiones porque
I want to make I have two insights here.
Si bien la tecnología aplicada a la salud tiene que ser un medio.
Technology applied to health should be a means, not an end.
El costo económico de los proyectos.
And leaders which will need to solve socioeconomic issues. If that is a means, I'm not going to give you the money to the project. But we have also to take into account that that is a means based on a more philosophical concept. Technology costs money. We cannot underestimate it to be able to have a good funds flow to keep up with the projects. One of the main causes to which the projects they do not take off, it's because the leaders they change and they do not take into account real costs and what will imply to use certain projects. With that in mind, I agree with the test because that will represent a huge problem. The main LLMs and that is a drama because it does not perceive that is a computer and it responds really well. Models which passes the tests because they are either lying or because they perform as human beings. the colleague who had asked on what should we insist on. There is a little percentage as we are assessing and assimilating the whole AI with the large models of languages, LLMs, and more to be debated about machine learning. And the main issue with machine learning is exactly that bias. To have a differential, we do need to have more data. And with more data, how does that will work? What Raymond has said, we do need to know how that has been done, how to use it, how to apply it, and evidences that we have as to machine learning in health, evidences are not effective because they have plenty of bias. And now thinking about LLMs, even worse, not just because LLMs are closed for training with a million and million data available, they are closed in terms of their database, I mean, and we have no idea about what is being created and how is this black box being generated or answers so differently from what took place 20 years ago when we started saying, well, this is a golden era. Right now we are exactly in the opposite time, very incipient with the large language models in the past 3 or 4 years. That's so recent. We have to be cautious about that. And to address your last question, data. If today anyone will implement a LLM with a health assistant, the safer way to do it is to do it outside the cloud to guarantee some control and to become more local, but that cannot be sustainable within time. If you have to work on the cloud with a trained LLMs model, we are going to be violating privacy, confidentiality, because even though we work with identification models, the health content may end up leading to disclose information which should not be. And to answer that question, I can say that today, in this risk matrix, I use this service alliance agreement with those who will be my suppliers. And of course, they have to comply with all the privacy confidentiality issues whenever whoever will be offering the services. But we cannot guarantee that that same very data will be applied later on for the training of different models. So I cannot forecast or precise what expect to the future. So it's been 25 years that we are checking that out, talking to hospital managers. There was a law in the past where I mean, it's a law which is still persistent. Everything should be written down, signed down because of the graphic auditing to know if I was really the author of that text or not, or if I was in compliance with the regulatory terms. So we have to be cautious, especially because we are dealing with our patients with health issues. We cannot just stop and wait, otherwise the technology will eat us down.
Bom, para encerrar então nosso painel, queria agradecer
to end our panel, I would like to thank very much all our guest speakers. This was very good. We could stay here the entire afternoon talking about that. I would also like to take the opportunity to thank all the experts of ICT health research and all Cetic partner organizations that made the ICT health survey possible, the Ministry of Health, WHO, CONAS, CONASENS, COREM, CERF, CRUSTO, CMB, and the São Paulo State Health Department, Unifesp, AICSOBEC, and I would also like to extend my special thanks to Cetic team. It's very good to work with people who are such good partners and competent.
Obrigada
you
pelas
so
excelentes
much.
reflexões
Thank
que
you
nos
for the
proporcionaram um
excellent
debate tão rico e
reflections that
inspirador. Eu
provided
convido
such
vocês
a
ao
rich and
palco aqui no
inspiring
centro para
debate.
fazer uma foto,
Now,
por
could you come to
favor?
the center of the stage to take a photograph?
Lá, por causa do Davi. Foi muito. E eu fico perto do Davi.
Bom, vamos então passar para a última sessão. Antes, um vídeo, por favor.
Let's
Oi, eu
see
sou
a video.
Amanda, moro em Osório, no Rio Grande do Sul, e tenho 20 anos. Os aplicativos que eu abro todos os dias é, sem dúvida, o Instagram, o WhatsApp. Para minha geração, essa relação de rede social, seja com amigo, seja com alguém que se admira, seja com pai, seja com familiares, eu acho que ela é muito tênue, tanto para a parte ruim e para a parte boa. Então, para mim, por exemplo, que moro longe dos meus pais, eu estou a 500 quilômetros da minha cidade, é muito boa, porque eu tenho essa relação de proximidade, consigo fazer uma ligação de vídeo e conversar, eu consigo matar um pouco da saudade. O papel da internet durante a pandemia foi essencial, porque ela foi tanto importante para que eu pudesse continuar estudando, quanto para manter minha relação com o mundo. Então, às vezes, acaba sendo uma relação muito fria, porque ali tu, dentro da rede social, não só com as pessoas que tu conhece, mas com pessoas que às vezes tu nem conhece, tem que lidar com certo comentário, com certa crítica, com certos falares, com certas falas que não te agradam naquele momento. De alguma maneira, a gente está exposto ali.
Bom, daremos início agora à última sessão do dia.
We are now going to start the
A
last
sessão principal
session,
3, educação e
which
bem-estar
is
de crianças
our
e adolescentes no ambiente
main
digital,
session,
que
thinking about
debaterá como crianças e
which will debate
adolescentes
how children and
podem se
adolescents
relacionar com as
can relate
tecnologias
to
digitais de
digital
forma a garantir a
technologies
promoção
in
e a
order to
proteção de
assure
seus
the
direitos,
promotion and
além de seu
protection
bem-estar.
of their rights in addition to
Entre
their
os aspectos
well-being.
críticos para esse
As part of
debate
the critical
estão as
aspects for
formas
this
de se
debate are
potencializar
the
as
ways of
oportunidades e
augmenting
mitigar os
opportunities
riscos
and
do
to
uso da
mitigate the
internet
risks
e
for the
das
use of the
tecnologias
internet
digitais
and
dentro
digital
e fora da escola.
technologies inside
Para
and outside
subsidiar o
schools.
debate,
And
temos a honra de
for
convidar ao
this
palco
debate, we
a
have the
keynote
honor
speaker,
of giving
senhora
the floor
Sônia
to our
Livingston,
keynote speaker,
que é
Sonia
professora no
Livingstone,
Departamento de
who is
Mídia
a
e
professor
Comunicação.
at the Media and Communication Department at LSE in the UK.
Sônia é professora no Departamento
Sonia
de
is a
Mídia e
professor
Comunicação
at
da
Media and
London School of
Communication
Economics
Department
and
at the London
Political
School of
Science.
Economics and
Ela
Political
publicou
Science.
21 livros
She
sobre
published
usos de
21
mídia,
books on the
riscos
use of
e
media,
oportunidades para
risks and
crianças e
opportunities for
jovens,
children and youth,
alfabetização midiática e direitos no
media
ambiente
literacy,
digital.
and rights
Fundou
in
a
the
rede de
digital environment.
pesquisa
She
Euclides
founded
Online,
the Euclides
financiada
Online
pela
Research
Comissão
Network,
Europeia em
funded by
33
EU
países,
in
e a
33
Global Kids
countries,
Online
and the Global
com a
Kids
Unicef,
Online
e
with the
atualmente
UNICEF.
lidera o
And
Centro
currently she
Digital
leads the
Futures
Digital
for
Center,
Children na
Futures for
LSE
Children
com a
at LSE
Five Rights Foundation, desculpe.
with the
Bem-vinda,
Fulbright
senhora Sônia.
Foundation.
Boa apresentação.
Welcome, Ms. Livingstone. The floor is yours.
Brilliant. Thank you so much for this invitation to speak today, and thank you, also for the decade of working together with Cetic.br, which has been a fabulous pleasure. I want to start by just waving Kids Online Brazil, which I am thrilled to see and to see every year because it's, as I'm going to say, it's been a particular struggle in the world of data and research to include children and children's experiences in a digital world in the data sets that are so important for public policy and for governments as they make their decisions. So I'll begin by, it really is a very warm thank you to everyone from Cetic, but especially Sandra. As you can see from my slides, at the London School of Economics, I direct the Digital Futures for Children Centre, and we have really been thinking for some years now about the relationship between research, evidence and statistics, and how that relates to advocacy, policy and social change. And that's it's that bridge between the evidence and the policy making that I want to address today in my remarks. And it has been very much part also of the agenda that we have developed collaboratively. So I'll begin, in fact, with the work of Global Kids Online, of which I began 10 years ago now, building on the previous decade of research of EU Kids Online, a European research initiative funded by the European Commission, where we really sought to get the necessary evidence to make for evidence-based policy. And perhaps in relation to children, more than many other segments of the audience, there is always policy making being done out of anxiety or out of supposition or based on the experience of one's own child. But in this domain, as in all the others that we have discussed today, getting nationally representative, high quality evidence is absolutely been crucial to our work. So building on the European work, I partnered with UNICEF Office of Research, and that allowed us to think more internationally, even globally, and that led us to become familiar with the experience of children in a digital world in many parts of the world. But I must say our partners in South America, really across the continent, have been the most dynamic and the most effective in ensuring and in generating a new evidence base that can be so very important. One of the things that we did at the very start of our Global Kids Online collaboration was to really make one very simple point, that children, which is those 0 to 18, children are 1 in 3 of the world's population, and they're also 1 in 3 of the world's internet users. And I invite you, whenever you hear conversation about the population or internet users or the public, to remember 1 in 3 and more than 1 in 3 in global majority countries where there are where the populations are younger. So this question of really understanding their experience and gaining the evidence is vital. At the same time, doing research with children is challenging, and for many it is so challenging they say this is difficult, we won't do it, we will leave it. So again, it is vital that we find the way to do it. Global Kids Online decided that we would really emphasize nationally representative surveys using a comparative conceptual model, agreed definitions of variables and common measures. There's always some variation necessarily for the different cultures and the different concerns in different parts of the world, but it is that comparative focus that allows us to make the cross-national comparisons, which I think has been particularly effective in getting the work taken up by governments and in developing the impact of the research. On our website, we have all our findings. Next week, I will add ICT Kids Online Brazil. I will also add Kids Online Argentina because they launched their new survey last week. So I've just come from Buenos Aires. And that was the first research they'd done for 10 years. Here it's done every year, which is fabulous and allows us to give some time trends. And next month there will be research from Bolivia, and so we continue. We are discussing in many countries. The purpose of the comparative measures then is that it sets a benchmark against which each country can measure change, improvement, we hope, for the conditions of children in a digital world, but not always improvement because there are new challenges and new risks, and we must know about those. And because we can compare across countries, we can also get an idea where some countries are finding a greater challenge, where some can learn from each other, and where are things going well. So in addition to our results, we also put up all our tools for researchers, and the tools are public. Anyone may use them, anyone may contribute more. In fact, one international group of colleagues have just developed a new module for measuring media and digital literacy, which we are also about to add to the website, given the importance of that particular topic. And within the tools, we have a short set of measures which could be included in a larger survey of the whole population or an omnibus survey addressing many different questions. So those key indicators have been adopted by the ITU as their international benchmark figures. And again, I think Cetic deserves some congratulations for that achievement, as well as the ITU. So, what can I say about the situation for children? So, I've put up here some data from the ITU's Global Connectivity Report of 2022, when they made a special feature of including children, as well as young people, as well as youth in their annual data report. They don't always, many people don't always. I would like to see children there every year, and then I could give you the 2025 figures. But still, the figures allow me to point to what is a really key dilemma. It's a policy dilemma. It's a dilemma as we try to interpret what are these statistics telling us about children's digital and online experiences. So they're telling us first, as we've heard today in the many discussions about access and equity, children are included within all those statistics. I hope you've heard children in those discussions about inclusion and access. And in many parts of the world, children are on the wrong side of the digital divide. They are often the most excluded, girls especially. And meaningful access to them may mean many things, and it may mean particular things to children. And for that, to know what that is, we must consult them. We must include them in our research process, as well as in our research data sets. One of the things I learned from the ICT Kids Online Brazil report is that the increase in children going online in Brazil over the last few years has been particularly from those who are poorer, younger, more excluded, more rural. And of course that makes sense because the more privileged are already online. So where is the increase in online access to come from? It's from those who are younger and poorer. And on the one hand, that improves equity. And on the other hand, it raises some new questions about vulnerability and about the particular policies and practices and programs that we need to ensure that when those poorer children get online, that they are particularly supported in terms of digital literacy, in terms of parental guidance, and in terms of educational provision. Much of their access, as I also learned from the report, is often mobile first or even mobile only. So those of us used to accessing the internet through our keyboards and our laptops and our multiple devices must try to imagine the ways in which one's access and participation is limited if a keyboard is all that one has. So, but still the pressure as we have heard today, is to get people online, and children often lead in that effort. They often gain the experience, if not the proficiency, ahead of their parents and their teachers, and that makes them in many ways the canaries in the coal mine of this digital age. They are the first to get the mobile, they are often the first and most experimental on social media. Now they're often the first to access a generative AI. And hence the concern, the data I illustrate from the second half of my slide, which puts together the costs, the problems of gaining access. Children struggle, and there are problems if they don't have access, but they also have problems if they do have access. And the data that we have here, I'm hoping you can read it, but it gives the statistics on children's exposure to risk in a number of different countries. And just measuring children's exposure to risk actually has been a struggle in many data gathering enterprises around the world, where people have not wanted to ask or considered it too difficult to ask children about some of the forms of digital risk online that they encounter. And that's even at the same time as every adult I meet is worried about this. You know, everyone is talking about the risks to children of being online. And yet, if you look in the evidence base, if you look in the data sets, that data is often not being collected. What the graph shows is for sizable minorities of children, and the minorities is important, it's not every child suffering with every form of risk, but for sizable minorities of children, the risks are becoming familiar, are becoming commonplace, and are often problematic. So last week in Argentina, for example, I heard that 24% of 12 to 17-year-olds have gambled online. And that's the kind of statistic that the researchers, in this case UNICEF Argentina, is taking to the government to try to work out what can be done. Do we need an educational solution? Do we need parental advice? Do we need government intervention? Do we need big tech, particularly, or the industry to act in new and better ways? Just a few comments from our research. Now that we have been collecting research evidence from so many different countries, we do find and we do insist that risk is something we can measure. Have you been exposed? Have you gambled? Have you been exposed to sexual content? Have you been exposed to suicide content, for example? It's not always the same as harm, because the translation to harm is a child damaged. Will they grow up badly? Has something really gone wrong in their lives? Depends on all the other factors that we also must measure in our research, in our evidence gathering. So we must understand what protects some children. What are the factors in their lives that protect them from exposure to risk so that it doesn't harm them? What are the vulnerability factors in their lives? And the answer in a nutshell will not surprise you, because the risk factors and the vulnerability factors are the ones that we've always known about in children's lives. They are the varieties of things that go wrong in children's home, in children's family, in children's circumstance, in children's school lives. These are the factors that lead them to be more advantaged online, if they have many protective factors, or more vulnerable and harmed online because they have many risk factors in their offline lives. Our research also reminds us, and this is perhaps one of the most difficult things, I think there's already a dilemma. Do we want the kids offline or do we want the kids online? The other really challenging dilemma, I think, is that we see how access brings both risks and opportunities, and they go together. We see endlessly a correlation. The more children pursue the opportunities, they get the access, they pursue the opportunities, they gain the literacy, but they also use the internet in ways that exposes them to further risk. And that's something a little different in the digital world than it is in the rest of children's lives, where we can hope that education will bring benefit without risk, where we can hope that friendship will bring benefit without risk. But online, you pursue learning, you pursue information, you pursue new friends, and it brings risk. And that tells us something about the way in which we have not yet managed, regulated the digital environment in ways that serves children's needs. And as we see the internet changing, the internet is no one thing, as we've also been discussing today. As we see how the internet is changing, we really see the transformations becoming too great for in many ways for many governments. Governments are struggling to regulate big tech, and we also see it very hard for children and educators to understand and to manage well. So this transforming internet, this always changing internet, is truly challenging. Just want to keep an eye on my timing. So how are we to think about this challenge, and how are we to advance both the research and the policy? So in my work, in the Global Kids Online work, in the work I do with UNICEF, also UNESCO and other UN bodies, a child rights approach is a really fundamental framework. And many or most countries around the world have begun to embed the Convention on the Rights of the Child into their national programs and legislation, as was their commitment when all of them, in fact, ratified the convention, all that is except the United States of America. And that's a really challenging and problematic omission for many reasons, but particularly in relation to the digital environment, where what we are dealing with in so many different contexts is children's relation to a world that is being reconfigured by the activities of American big tech companies. So I like to put up all the articles in the Convention on the Rights of the Child, because a child rights approach is holistic. So it reminds us always to think of the big picture, and always to think about how the different articles, the different concerns that we have impact on and might be dependent on each other in ways that can be familiar, but also can be neglected or misunderstood if we're not careful. The convention works on multiple levels, and I think it's also very useful in these kind of multi-actor, multi-stakeholder discussions to think it works conceptually as a way of thinking. What are the issues for children? So I can ask you, we've theorized privacy or safety or participation for generations, but now we have to think of the new question: what does privacy mean online? What does safety mean in a digital world? What does it mean for children to participate in a digital world that is largely not of their own making? So it gives us some conceptual tools, it gives us the principles, it's a legal framework, an international legal framework, and it comes with very many procedural and organizational toolkits and jurisprudence and organizations with the expertise to kind of help scaffold and enable the interpretation and the implementation of the convention. So in relation to a digital world, we can think of the articles in the convention, if you like, as kind of minimum standards for the design of our digital technologies. And still we have, and in 2021, I was very pleased to work with the UN Committee on the Rights of the Child, who generated their General Comment 25, which is the key document in international law, which sets out how the Convention on the Rights of the Child applies in relation to the digital environment. And it articulates both it conceptually and also very pragmatically what are the expectations for governments around the world, and how can they advance children's protection, provision, privacy, participation rights, and so forth, in a world which is so fast changing. It's fast changing in many ways, but definitely in relation to technology. General Comment 25 also reminds us that this thing I'm calling the internet, that we all here know to be enormously complicated, must be thought about in multiple ways. And here too, we must try to be holistic. It's very easy when one sees a child holding a smartphone to think about the device. And a lot of our thinking about children focuses on devices and the particular applications or services that they access. There's less thinking, and actually I think we struggle with the words even to think about the kind of digital spaces, the digital context in which children are now learning and seeing their friends and playing in new kinds of spaces. They might be hybrid, they might be purely online. They always have an offline material reality, of course, but this is a space that must be also understood. And then most crucially, and where we most often forget children, is to recognize the ways in which society is being reshaped by digital technologies in terms of the very infrastructure of society. So as we will talk about on the panel, the infrastructure for education is being transformed by the influx of edtech. We've just been considering how the infrastructure for health is being transformed by the use of health technologies. We can see the same in the worlds of information or work or commerce or entertainment, politics, welfare, you name it. The technology is now part of the infrastructure. When we have those debates about the infrastructure for health or the infrastructure for welfare, we tend to forget that 1 in 3 are children, and that even though the child may not be holding the device that matters or that accesses this infrastructure, they are being impacted by the operation of this infrastructure. And what is most notable about the infrastructure that we now have adopted for all sectors of our lives increasingly is firstly that it is global or transnational and interconnected in complex ways, and most importantly that it is commercial. So once public education systems are now being underpinned by private companies, once public healthcare systems are now being underpinned by private sector. And this transforms children's risks and opportunities, children's rights, as well as everyone else's in ways that we are really only just beginning to grasp. So I want to kind of take forward some of the questions about a child rights approach. I'm going to stick to the 3 areas that we have. Well, maybe I'm not. The time is climbing down, I see. So maybe I will offer you my kind of overview and some thoughts about how I think we can grapple with this question of a global, interconnected, increasingly commercialized infrastructure underpinning so much of children's rights. So I want to talk about the idea of, and end on the idea of child rights by design. We have come, several of us talking over the years have come to the idea of child rights by design because we need to find a way collectively of making the translation from the policymakers who understand about child rights to the very many stakeholders who are really not, who really know not so much about children, let alone child rights, but they are building that infrastructure. They are from constructing the LLMs to coding the software, to designing the safety features, to setting up the procurement rules in public organizations, across a whole complex value chain. There are very many actors who are part of the design and construction of an infrastructure, but are not necessarily reached by advocacy for children's rights or aware of the evidence that we produce in reports like this. So we took at the Digital Futures for Children Centre, we took the articles of the convention and we took all the requirements of General Comment 25 and we put them into 5 principles. 11 core principles, which we have worked with both children and also with designers and developers to kind of try to find a language of bridging from the child rights experts to the technology experts, if you like. And so our questions and our principles have been designed, in this case, particularly with the developers and creators of digital products. And I'm thinking now everyone from the kind of CEO to the designer to the marketer who many of them write to me, they write to my colleagues, they say, how can we do better? What is the right way of respecting children online? What are the possibilities for children online? What would be age appropriate for children online? Many of them, particularly the most influential ones, do not write to me all the time. So this is where we need regulation. And child rights by design is also intended, if you like, as what good looks like for the regulators, that they could say, this is what we need to operate. We need a world in which, as has been said, equity and diversity are respected, including for children. We need a digital world where children's best interests are embedded in the design of services. We need a world where children have been consulted in the process of developing the technologies that matter for them. We need a world that is age appropriate. This is so hard, but it is so important. Children are not all the same. 0 to 18 is absolutely not all the same. They need different services. They need different contents. People need guidance on what that looks like. What does good look like for that? We need responsible business, as we've also heard earlier, as well as responsible governments when they bring in their edtech solution in heavy scare quotes. And we need children's participation, as we will discuss in the panel. We need a world in which it is possible for children to participate. The articles of children's rights, indeed of human rights, of the right to access information, the right to expression, to assembly, these apply to children as well as they apply to the adult population. We so easily forget that. And yes, of course, privacy and safety are critical. And we have already models for privacy by design and for safety by design. We've, as it were, made some beginning with the effort for developing by design solutions, if you like, by design ways forward for the kind of hygiene factors for trying to eliminate the problems. We haven't succeeded in implementing it yet, but we kind of know what good looks like there. But we need to remember that children's rights are holistic. So all of these are important, and well-being and development are perhaps the ones that are on the table now as most contentious. There's a lot of discussion about banning children from social media or banning children from owning smartphones, whatever it might be, on the grounds of well-being. You may know there's been quite a major debate there, and continues to be. Perhaps we will have it a little more in the panel now. But designing for well-being and designing for children's well-being is beginning to be a thing. And there are, if you like, some good actors who are seeking to develop the good practice in that regard. Children need to develop, the 10th principle. And here we have included the rights to play, including playing online in digital spaces, to imagination, to belonging, and to learning. And as I've hinted, I think there are some concerns about the ways in which technology is being brought into schools and being brought in to enable children's learning that sometimes seems more to be technology looking for a solution than technology designed to meet the learning needs of children and the requirements of schools. And last, agency. And agency really brings me back to the article in the Convention on the Rights of the Child, the right not to be commercially exploited. And this matters in so many ways when we have taken a commercial infrastructure and put it underneath the entirety of our children's lives. So the idea is to kind of build on something that the industry is already beginning to know with regulation and legislation for privacy by design and safety by design, to kind of show what good looks like for those who would like to take this forward, and to urge those who haven't thought about it yet or haven't thought yet about children in a digital world to recognize that there are very many other directions in which we need to go. And there are small ways in which I can see this happening. I would love this today. Perhaps Brazil can be a great instance of taking this forward. There are movements for design, like Design It For Us, Design for Children's Rights. There are design toolkits. There is a call to design with children in mind. I mean, that idea that we really think about behind the device, in the infrastructure that enables our digital world, all of those different professionals and actors who are making a difference to children's lives need to become somehow reached and aware of what good looks like for their work. So I will stop there, and thank you so much for your attention.
Muito obrigada pela apresentação. Thank you very much, Mr. Sonia. Peço que permaneça ao palco e para moderar o painel.
Please stick with us, and to moderate this panel, Mr. Mario Volpe, who is the coordinator of the Program of Development and Participations of Youth and Adolescents, representing here UNICEF Brazil. Welcome.
E para compor o debate, contamos com a presença de
And we have a number of experts who are invited to participate at this session. We have Ana Unguri Dal Fabro from the Education Ministry, Brazil. Cristina Ponte, who is a teacher at the University Nova, Lisbon, Portugal. Mr. Cristóbal Cobo, who is an expert in digital education. And Patricio Cabello, professor at the University of Chile and also Andrés Bello University.
Bem-vindas e bem-vindos. Passo a palavra ao moderador. Bom debate a vocês.
Welcome. And now the moderator has the floor. Enjoy.
Boa tarde a todas.
Good afternoon, everyone.
Queria cumprimentar
I would like to greet Cetic for your 20 years. I don't think it sounds as a good idea to stand up and sing a happy birthday to you. Anyhow, I would like to thank the great collaboration that Cetic has taken about social inclusion, children's interests, the broader use of the internet, and the whole debate around those lines. My goal is to see infancy and adolescence as a special developmental phase, and Cetic has set an alliance with different institutions since the very beginning to understand that anytime we are studying and addressing children's rights, we have to be very careful because we are talking about an individual which is under a special developmental phase. And I loved Sonia's slides. Did you see? how many
40
interests children
42
have?
direitos.
42,
estamos
42
falando de um
rights.
sujeito
We are not
qualquer
talking
numa
about
sociedade
any
qualquer, né?
subject
Eu acho
or
que esse
any society.
posicionamento de promover estudos, discussões,
And
uma
the
análise a
possibility
partir
of
da perspectiva
developing
do
training,
direito
discussions,
contribuiu de uma
analysis
forma
based
enorme para o
on a legal
país
perspective
entender do que se
has
está
been
falando quando
extremely
se está
helpful
falando
to
de
the
inclusão
country
digital de
to
crianças e
understand what
adolescentes.
we are talking
Então,
about
queria
anytime we
cumprimentar o
talk about
Cetic por esse
digital inclusion
trabalho
for
e
children and
trazer aqui
adolescents.
até um depoimento pessoal do
I have a
início
personal
desses estudos, né,
testimonial
quando a gente fez
of the very
oficinas com
beginning of those
adolescentes e a gente
surveys
começou a perceber
when
essa
we
mudança
organized
e essas
workshops with our
diferentes
adolescents,
visões, né,
and
do
we
que a
were
gente
able to
fala
see
de
changes and different
acessar a
perspectives
internet,
when we
né?
talk about
Quando a gente foi
assessing
falar dos
the
adolescentes, fala
internet.
acessar, falando, mas eu tô na internet. Eles
Says
estão
the
falando em
internet, but
estar. Então
here I
vocês
am.
imaginem,
They say
né,
I
a minha
am
formação é
in the
filosofia.
web,
Como
not
filósofo,
obsessed in the web.
imaginar
I am a
que um adolescente
philosopher.
ele está na
Can you
sala de
imagine
aula,
how difficult it is for
jogando
an
e está na
adolescent who is
internet ao mesmo
in the
tempo, né?
classroom,
Então
he's
isso uma
playing, and
mudança
he is
na
in the web
visão, né,
simultaneously?
sobre como as
So
crianças
that
e os
is a
adolescentes
change
estão
in the
produzindo a
perspective
sua
as how
vida, a sua
children and
existência,
adolescents
né,
are
nessa
producing their
relação
lives,
com as
their
tecnologias de informação e
existence in
comunicação.
relation
Eu acho que
to technologies,
eu
in
queria
relation to the ICTs.
reforçar essa ideia, né, de que esses estudos todos nos trouxeram a esse
All of
momento
that led us
importante
to
onde a
this
gente
relevant
precisa,
time
né,
where
analisar esses riscos
we have
e
to understand
oportunidades
what the
que,
risks and
né, as
opportunities
tecnologias de
are
informação e comunicação
and how the
representam para as crianças e
ICTs
adolescentes. Não é?
and what's
É
the meaning of ICTs
eu acho
to
que aí
our children
não
and
se trata
teenagers.
muito de uma escolha tecnológica, se
That's
trata de
not
uma escolha mesmo
simply a
política
technological
do
choice, but
que a
rather
gente
a
quer para as
political
nossas
choice
crianças e adolescentes.
regarding what
Né?
are we
Então, acho que
expecting to
as
give
reflexões,
or
os
to our
estudos,
children
né,
and
as
adolescents.
informações que nós
So all the
estamos
insights and
apresentando,
all the
elas
information
nos
which is
jogam,
being
sim,
raised
né, para a
here and
necessidade
all
de
over,
uma
they take
regulação,
us
né, e
to
de uma
a need
proteção
to
das
understand
crianças,
that it
não
should
é,
be a
nas
regulatory
tecnologias
framework
de informação e
to
comunicação.
safeguard
Não é? É
our
desafio
children
muito
and
grande, né?
adolescents.
Não
I
pode ser,
understand
né,
that
como
represents
alguns dizem,
a
não, mas a
huge
internet é igual à vida
challenge.
real, tem
Well,
riscos e
internet is like
oportunidades,
real
né?
life with risks and
Então, na
opportunities.
verdade,
Come on,
é
let's
igual à vida real. As crianças continuam tendo
face
os
it.
seus
Okay,
42
it's like
direitos,
real life,
né,
but
e que
children,
devem
they
ser
still have
assegurados
those
pela
42
família,
rights which
pela
should be
comunidade e pelo
ensured by
Estado.
the family, by the
Então,
community,
se
and
você
by
não é
the
da família, mas
states.
é da
If you are
comunidade, você
not from
também
the
tem
family, but you are from the
responsabilidade. Se
community,
você
you
não é
are
nem da
also
família nem da
liable. If you
comunidade,
are
mas você é
neither
um
from the
gestor,
family nor
você tem a
community, but you are a
responsabilidade do
manager,
Estado, né?
you are also
Então, eu queria
liable as you
só
have the
fazer essa
state
introdução rápida para
responsibility.
dizer, né,
So
que
those introduction
93%
words
das crianças e adolescentes de
aim
9
to
a
say
17
that
anos, né,
children
as
between
informações que o
9
CETIC está
and
disponibilizando,
16,
né,
17 years of
fazem
age,
uso, não é, da internet,
they
acessam a
make
internet.
use of internet. It's a high percentage.
Nós temos aí recentemente uma mudança no paradigma legal
There is a change in the legal framework paradigm for children's
né, que é a
protections, which may
proibição
sound
do
a
uso
little
dos
bit
celulares
ambiguous,
na sala de
which is the
aula, mas ao
prohibition
mesmo
of the
tempo
use
nós
of
temos uma lei de
smartphones
proteção
in the
dos direitos
classrooms,
das
but at
crianças
the same
contra as
time we
violências
have
nas plataformas digitais
a
que
protection
ainda não
law
não foi
against the
aprovada, que
children
ainda
at
está em
digital
discussão. Então a
platforms,
gente foi
which
mais
has not
rápido
been
na
approved yet,
proibição e
is
um
under
pouco mais
discussion.
lento
We
na
were very fast
regulação,
in the
né? Acho que
prohibition
é
and a bit
preciso
slowly
discutir
in the
isso.
regulation.
Eu
So
acho
in
que
the
nós temos
regulatory efforts,
duas grandes contribuições, que é o
we have two
Kids
main
Online,
contributions, which is Kids
traz
Online
informações muito
ICTs.
vastas e
This
profundas, né,
ICT
sobre
is extremely comprehensive with
as
very
redes
important
sociais e o
information
uso
about
de
social
crianças e
media
adolescentes,
and
né?
how children
E
and
o TIC
adolescents
Educação,
make
que
use of
mostra como
their
os
social
professores, os alunos,
media
os
and
diretores estão
ICT
fazendo
educations, which show shows
o
how
uso ou não, né,
children and
das
teachers
tecnologias de
are
informação e
making the
comunicação.
best use or not
Então,
of
sem mais
those
delongas, eu
technologies,
queria
information and communication. With no further ado,
passar para a
now
doutora
I'd
Cristina
like
Ponte
to
para
hand over
começar
to Dr. Cristina
esse nosso
Pontes
debate aqui, trazendo um pouco
to
onde
hear
nós
her
estamos
comments
nesse
and to
momento, nessa
understand
produção de
where we
conhecimento,
are
nas
right now
informações,
in the knowledge
e de que ponto nós
development
chegamos,
and
né,
at
para
where we are
entender
right now
as tecnologias de informação
to
e
understand
comunicação no
ICTs
contexto dos direitos da criança e do
within
adolescente. Doutora
a
Cristina.
setting of children's and adolescents privacy. Thank you for the opportunity to be here. Briefly, let me share that Kids Online ICTs started back then in 2011, but my first contact was with Guilherme Canella, who was one of the subjects in charge of the leadership of this endeavor, and that became a reference to me as how Brazil was dealing with kids and adolescents. In 2016, I was introduced to Fábio in Brasilia. In 2011, Guilherme got in touch with me to share that the first European survey of kids online ICTs, I got in touch with Sonia and Canela and Alexandre Barbosa, this wonderful pair of experts. They joined me in London and they wouldn't leave without having the protocol signed out. It has always been very clear the concerns about the children's rights by Cetic, and now with the great support of the Justice Ministry, but it was a Cetic demand to carry out this survey, which was ongoing in Europe. I am part of ICT's Kids Online. Thank you, Sonia, for inviting me and to be part of that. It has been an amazing experience, the possibility to compare European results to Brazilians results. And we noticed right away that we had two different scenarios here. Brazil in 2012, the presence of smartphones for internet access, it would exceed the European realities, even though Brazil would have less infrastructure maybe than other countries. This past report is great. I was glad to read the final publications of Kids Online ICTs. And that is a privilege that Brazil has thanks to Cetic. We do not have that in Europe. Differently from what it may look like, we had an European funds for the first survey, but those funds were over in 2014. And ever since, to be able to go on to carry out other studies, surveys, each participant country has to be in charge of their own fundings and reaching, fundings that's not easy at all. And since 2010, the second largest European study, which included 19 countries, and it was conducted from 2017 to 2019. And right now, we are about to carry out a third step of our surveys. So our pace is much slower than yours here in this country. There are always new issues that come up, and we want to see how digital context in 2025 has little to do with the digital context from 2010, and as to digital framework from 2018, we anticipated that there will be others to be highlighted, such as access to internet via cell phones, which is 2 times higher than the access to internet via a computer device. According to the European questionnaire from 2018, cell phones access would be twice as higher than the regular access by computer, and there are concerns which they have to do with time. In 2018, we had raised some issues about radicalization, hate speech, which are topics which will be once again in the new questionnaire. In 2018, nobody would even dare dreaming about AI. And now within this new questionnaire, now we have to include questions about access and use of AI by adolescents and adults. This large European questionnaire will be conducted at as many countries as possible, and that will be complemented by qualitative surveys. And I guess that at Cetic, you also have some experience with qualitative surveys and data. I guess they are important. Quantitative, they give us standards, but the qualitative ones, they allow us to have a better perception about the insights, ideas, proposals, and what is really behind those answers that were given by children and adolescents. And right now we are conducting a qualitative study about youngsters that use AI skills or AI functions, asking them what are their main practices, what they expect, if they are optimistic or not about the technology, and this survey will become published and available by the end of the year, and it will enlighten us considerably about the results that we got from the questionnaire. In the meantime, we foresee a possibility to get an European fundings for digital competencies, and the name of the project was Youth Skills, and that has involved the network investigators as well as a large interdisciplinary team, including neuroscientists, and the result of the study, which had emphasized adolescents, where once again we see that they are concerned about cell phone access, the importance of social media. They have highlight their difficulties to search for information in the web. If that issue would be taking place now, many youngsters would think difficult to find information. And ChatGPT, which was an application that was not available by the time of the study. This study was conducted once again with the same adolescents, and the idea was to follow those adolescents for 3 years, a 3 years period follow-up. They all improved their digital skills, but not enough. So far, we understand, we see that digital competences capacity building is quite hard. And from this project, Epsilon Skills, there are a number of resources which have been a result of a number of tools which are applied for researchers, and all those resources and tools are available in Portuguese. And among them, I'd like to highlight an educational kit which may be used by Brazilian schools. We have to benefit from the advantage to have the same language. Thank you. Thank
Nós
you.
aqui, você sabe que nós combinamos as perguntas, então eu vou aqui agora passar para o Patrício Cabejo, do Chile, que desenvolveu o Latte Kids Online,
We have
não é?
agreed on the
Vai contar
questions,
pouco agora
and
dessa
now
história,
we are
quais
going
são
to see a little bit
as
about
principais
the story
aprendizagens
of
e
the main
pouco,
lessons
Patrício, entrar
learned,
também nessa
and going a
relação
little bit
da
into this
escola com as
relationship
tecnologias de
of
informação
schools
também,
and
desse ambiente
information
educacional.
technologies
Então,
in
compartilha
the
com a gente
educational
aqui a
environment. Could you share
experiência do
with us a
Chile.
little bit about your
Thank you, Maria.
experience in Chile?
First of all, thank you for the invitation.
Bom, em
And
primeiro.
thank you, Alexandre, and all the team of Cetic. I'm very proud and very happy to be here to sharing with you a few thoughts about your question, but also trying to tell something about the history that we have with Cetic and the network. I would like to say something. Where were we before starting this journey with EU Kids Online, then Global Kids Online, Latin American Kids Online? That we were in a stage like the dark ages in Chile and in parts of Latin America. Where even public policy were talking from a point of view more guided for moral panic or a lack of knowledge about the digital practices of children. And even public policy were talking about the digital natives and other expressions that we have been discussing we discussed in the past for a few years. After we started like a second stage for us that was to adopt the Kids Online framework. And that's when we met other partners, especially when we met Cetic, when we met Alexandre and Fabio, and we started to work together. And we started to try to conduct this not only in Chile and Brazil, but always thinking that this should be conducted in other Latin American countries. So we have to support the other Latin American countries. And quickly, Uruguay started their work. Argentina started to do something. Other countries started to be more and more interested in doing this. Now we have a Latin American network where there is Argentina and Bolivia as our new partners, recently officially new partners. Costa Rica, Chile, Uruguay, Brazil, even Dominican Republic in some point worked with us also. And so we learn lots of things about things that we are now addressing on research. For example, things that you have said or many others have said today, the importance of meaningful access, for example, habilitating access for the expression of those rights that Sonia pointed out before. The role of mediation, the teacher's mediation, all the structural disadvantages in our region, how these structural disadvantages replicate and amplify online, all the gender gaps, for example, that led us now to work more, for example, from the intersectionality framework, that it was something that we didn't know before, and we have been working in the late years about that, to identify who is at more risk, and of course, to adopt this point of view of how can we reduce risks and how can we strengthen the opportunities of children. So we learn many things that we're still analyzing data and so on, but we learn something that for me it's even as important as that, and it's how we approach to this. And this model of multi-stakeholder for us was very enlightening, because I come from a university research thing type of goals, that to publish and to analyze and publish and publish and publish. And we do not conduct all the time this kind of research so rooted on public policy and the partnership of the institutions that can make things possible in the public discussion. So this is how we are now. And we are now moving not only about this agency of children, but we are incorporating what's the agency of other actors that we, as network, especially in Chile, I think we were kind of forgetting or not addressing before, what is happening with regulation and regulators what are the possibilities from our institutions to regulate the internet and the digital experiences of children? Are the possibilities to take a voice on that discussion? And I think we're moving more forward to that. So that's the journey of us. We have built a community. We have built a lot of, and I think we're more active than ever. We have, or most of the countries of our network have conducted at least two waves of Kids Online. We first did it in 2016, then in 2022. This year we will conduct another research focus on cyberbullying in Chile. We have everything for that. We will start our field work in September. And we're planning more qualitative research. We are working with other partners now for the creation of an observatory on governance and regulation. And also we're trying to create a new center in Chile. We are applying for that. And that was a huge step for us to call the public agencies, to call the Ministry of Education, to call people that we have been working and propose them to be partners in this creation of this new center that we hope that will be a reality, maybe, if we get the funding. And about your question on education, in the minute that I have, we are addressing that, but in a different way that we used to do, I think a year or 2 years ago. We were too much concerned about working only with teachers. So from this point of view, that we will teach or train them to do something at schools. But we know that we need more powerful approach. That teachers only have a limited power on what they can do. The curriculum, for example, is something they are obliged to approach in a certain way. So now we are trying to make an impact of how policy is being discussed, of how teachers should be trained, for example. And also to work with them in professional development programs, especially training skills for the work of digital skills and also computational thinking. We're working on that too. So that's what we are kind of doing. I don't know if I was too dispersed. But okay.
Perfect. Thank you. Thank you very much. Nós vamos tentar conectar aqui. Nós estamos conectando um pouco pesquisa, né, educação.
We are going to try and connect research, education, and how digital inclusion gets to classrooms. But in everyday conversation over lunch with Cristóvão, we saw another connection that we need to establish, which is how these processes of digital inclusion, how schools are learning to deal with educational process that will benefit from technologies, and how we can connect everything to artificial intelligence. So this is the challenge for Cristóvão to share a few reflections with us.
Thank you very much. I have to say that we did not drink any wine during the lunch, so it was a very sober discussion.
No wine.
No wine at all whatsoever. So first of all, I have to say I'm here in personal capacity, but I wanted to be here in this birthday. I think for me, Cetic is a lighthouse for the whole region. We are always looking at the things that you guys are doing. So thank you for the work. Thank you for the inspiration, and we will keep collaborating very closely. Now, I want to do a little bit of a time machine because we are celebrating the 20 years. But 30 years ago, when Al Gore made popular this idea of the information superhighway, we were a little bit naive because we thought the more people in the highway, the better. The faster everybody can run at the speed that they wanted. But along the way, we learned very fast that some cars were driving faster than others. Some people would not have chance to jump in any bus or car in that highway. And unfortunately, in that highway would be some accidents and some people will be harmed. So we learned along the way that we were very naive, but we could have improved that highway with traffic lights, with traffic signs, and with a lot of education. So now we are in a kind of transitioning to a different kind of highway in which now cars start to drive on their own. without our supervision or without our proficiency. And that is a completely different game. We don't know exactly how we're going to navigate in this highway, but fortunately, we have a lot of evidence of things that we have learned during these 30 years that I think is a good idea to take into account. Number one, adaptation is key. Contextualization is essential. The one-size-fits-all is not going to work. Number two, quality of implementation is something that we have seen in many cases is one of the weakest points. And number three, scalability always have a trade-off. So with these three basic lessons that we have gathered from the EdTech 1.0, we can probably will be a little bit better equipped to the current landscape in which we are. What are the challenges? We all know the challenge. One, we are having a discussion about a technology that we don't fully understand, a technology that is quickly evolving, and the speed challenge that is evolving very fast, that even those who are studying that, when they publish documents about that, is already obsolete, let alone the public policy. So we will have an interesting discussion. And when I was listening to Sonia, all the challenges that she's bringing to us, which are really relevant, I was thinking, how on earth are we going to cope with the complete landscape that AI is bringing? But if we leverage on the things that we have learned, we should have a discussion in terms of how prepare systems that are AI ready, how to develop proficiencies in a expanded understanding of digital competency or a new way of understanding AI literacy that should include understanding, apply, and evaluate, at least. And in that setting, we will probably will be a little bit better equipped. But it's not going to be a one-size-fits-all because different language models, different algorithms will entail different opportunities, but at the same different challenges. The strategies that we might want to design for teachers are going to be very different to the strategies that we need to develop for decision makers, let alone for kids. So my invitation here is understanding this speed gap that we have. We should be open for thinking, do we have the institutional capacities that we need for this new game, or we have to develop different ones, or we have to develop different capacities? I don't think we should address this within countries. We have to work in these problems inter-country. So initiatives like Kids Online, but many others that allow countries to learn from others, I think it's going to be essential to work in an environment in which machines may end up taking decisions on our behalf.
Muito obrigado. Não posso deixar de comentar
Thank
aqui
you so much. I mustn't fail to mention, and I live in Brasilia, and we've been following up bills, and there is already a discussion about the regulation of artificial intelligence. And someone working in the Congress has filed a bill to see if to regulate that. So this is quite an interesting regulation might be done by the very mechanism that wants to be regulated. But these are the challenges of technology. Now, let's move to a discussion of educational policies and how they can integrate
o projeto pedagógico da escola, como que ele
the
pode
pedagogical project of schools and how they can receive and include new technologies, which are the dilemmas and what is being discussed on this theme here in Brazil. So I would like to give the floor to Ana Ungari Dalfabro from the Ministry of Education. Good afternoon, everyone. First of all, I would like to thank you very much, Cetic, for the invitation. And so the Ministry of Education is a major consumer of Cetic researches, Cetic Kids, Cetic Education, everything. We look forward to every new issue of research because this is the basis for us to define which way to go for this huge challenge, which is to navigate this world of digital information. The federal government launched in 2023 a document that was to try and address this challenge, to provide education with technology for inclusion in digital citizenship. And according to that vision, there are two simultaneous challenges which are equally large. One is to be able to include our schools that today do not have internet access or do not have meaningful connectivity, as Sonia mentioned this morning, and this other challenge, which is to be able to prepare our students to experience, navigate, and to stop being just being consumers and victims in the digital world, but to be active and critical and free-thinking players. So, we're talking about Brazil beyond education, but this is very much reflected in the universe of education. So we have a challenge today of lots of inequality in access to connectivity in terms of digital devices between public and private schools, between different regions in the country. It's very different to analyze public schools in the south and southeast, something completely different to talk about schools in the Amazonian region, some schools without electricity even, and that's why the federal government has been investing heavily in connectivity, more than 2 billion since 2023, invested for us to assure that our schools will have the internet and computers so that we can use technologies appropriately in schools. And there is where comes a debate that the ministry has been leading with all education systems. So we want to have technology, digital technologies inside schools, and then the sponsorship that MEC has been giving to the new law limiting the use of cell phones by students at schools. Yes, we want our students to use technologies, but we do not want the use of technology inside schools to come as a distraction for students or to take them away and divert them from something that is very important at school, which is the experience and relationship with colleagues during breaks. That's why the Ministry of Education has been working in terms of limiting the use of cell phones at school so that students are present, pay attention at school, not just as academic contents, but also colleagues, the human aspect. And the other thing is the look at the progressive autonomy of students with technologies. One thing is to talk about technologies with little children, and that they need to be more protected, to go into this universe slightly later, and then something else is to discuss which kinds of use of technologies a high school student will have, or if they're going to university and how they're going to use this. So still a relevant debate so that we cannot just take technology, but at the right time, mediated by teachers, so that we're able to have this vision of critical digital education, preparing our students for the challenges that are new every day. So every day schools get another piece of news of another major risk that the internet is offering. So we've been talking a lot about AI companions and their use among students. And then we get to the second major challenge, which is to prepare our teachers and all everyone working in education, not just teachers, but the managers, to understand about all the systems. I think that we are all users today of technologies, but it's very different to use a technology at home or in the classroom. It's different to develop new digital competencies that are necessary to work with all the systems and all these challenges with students, and very much along the lines of what Sonia says, to hear them. What is the entire experience interaction with the digital world? So on this front, we've been working especially with two major axes. One is a rediscussion of what we need to teach to our schools in terms of the syllabus. So recently, the Ministry of Education approved the new guidelines providing guidance on the themes that need to be discussed in terms of digital and media education at schools, a very important role for the state departments of education to bring this to the day-to-day and teachers to include these discussions in the classroom. And the ministry launched last year a new metrics of teaching competencies for self-diagnosis so that teachers can identify how familiar they are with all these technologies and to show the paths for education, which themes they need to study and develop further using the Ministry of Education platforms. And the ministry plays the role of coordinating. It's like a big manager for the country. We want to have an increasingly closer contact with more than 5,000 departments of education across the country. So the major effort of technical advice to states, also specialization. We have students in more than 4,900 cities, so Brazil is so big. So it's a huge challenge. So we still need to take some connectivity to a school in the Amazon. We need to discuss AI in the classroom. In other in the schools, our students are using it already. This is present in their lives. It's a challenge. It's not just education that is going to handle it alone. So these things come up at the doors of schools, and schools our parents go to schools to ask questions, but we have been advancing in this coordination and management of many different areas at the federal government. There is a new guide, and the guide for children, adolescents, and screens. It's a joint guideline for the Ministry of Education and the Digital Policies Department of the third sector and academia who participated in drafting this document so that we have coordinated action, not just education, together with the Department of Justice, so that we can think of the digital future of our students so that they are better prepared for the constant evolution of the risks and challenges. I think that we can assure that this is top priority for the federal government, for the Ministry of Education, and this is it. We're after that.
Muito obrigado, Ana.
Thank you so much, Anna. In the meantime, while people are getting ready to ask your questions, I would like to give the floor to Professor Sonia to make a comment about this first round of presentations.
Thank you so much. So just thinking about getting double voice. Just thinking about Chris's invitation to go back to Web 1. You know, when in the early days, academics were doing a lot of research, which I hear nothing of now. Maybe I'm missing it. But we used to say, with Microsoft, where do you want to go today? What do you want to do? It was like an exciting moment of possibility, and we were excited for our children. And the researchers amongst us were studying children who were geeks and hobbyists, and we talked about digital storytelling, and we talked about how they were creating music and artwork and sharing it and experimenting. And now we hear all of those words as bad. We don't want our kids to share. We don't want them to explore. We don't want them to create. We don't want them to experiment. We don't want them to take risks. You know, all the things we know are important for development and for children to grow. We are terrified online. So I just want to hear where the solutions are, because we're not going to make it go away, and we're not going to have our children grow up in a kind of a previous century while we're all living in this century. It doesn't make any sense. So the second observation that occurred to me was, I don't know when it happened in Brazil, but over the last few months in the EU Kids Online network, we've been sharing what was on our phone. Hey, I've got AI on my WhatsApp. Have you? No, I haven't got it in this country yet. Oh no, I haven't got. Yeah, but I've got it. What about search? Yes, search. AI suddenly appeared in search, Gemini in Google. It was here. It wasn't. It happens at the tech company's timing. And then we suddenly say, we have to educate our kids. We have to advise our parents. We have to change our school curriculum, right? We are jumping to their tune. We're not telling them, this is what we need in our schools. This is what children need for their play. This is how we want children to grow up in a digital world. And this is the tech that we would pay for. You know, there could be a market, but we're not telling them. So we are jumping to their tune, and we've lost that early excitement.
Thank you. Thank you very much. Yeah, no, that's important.
Good afternoon, everyone. My name is Sérgio. Meu nome é Sérgio Eduardo Antônio.
My name is Sergio.
A special question, task to pass to Sonia, but here we have a task force education people, né? And I will change. I would like to change this same task to everyone here. Ok? Ok. Em português. Eu sou pai de uma criança com síndrome de Down.
I am a father of a child who's got Down syndrome. And now I was searching at Google because I would not remember what is the percentage of children who are born with Down syndrome. According to Google, 1 to 700 borns are with Down syndrome. And that amounts in Brazil 300,000, according to Google, 300,000 children. And in terms of transparency on item 4, which talks about ages, I also see age in the parental control, but that's not enough. Your expertise, all your task force could do something else, especially for children with Down syndrome, which is not a matter of age, but to be naive, their naiveness. So in your to-do list notebook, please include and look after a little bit about those children who are born with Down syndrome, because they use comprehensively the internet all day long, cell phones, tablet, computers. My son is today 29 years of age, and he uses and he accesses the web every single day, and all his friends the same, and the parental control is not enough. I'm sorry. So I hope that you do something about that. Please throw a seed. Maybe include some norms. Look after that. Item 4, naiveness. I don't know if the right word in English is that, but he's talking about his son being naive and all children with Down syndrome. Okay, let's get another question and then we can answer them, all of them at once. First of all, I'd like to congratulate Cetic for celebrating 20 years, and you perform a wonderful work. Here, a more ethical aspect. We know that language is key to learn something, to teach, to be able to understand as how things work. Talking about language, we mean that those who design a language, they design a world perspective or a concept. And now I ask you, how may I call artificial intelligence being artificial intelligence if they are not intelligent? We know that that's not a novelty. Artificial intelligence determines 0.1. Even the largest LLMs that we have available today. How am I going to explain to a child what artificial intelligence is? Is she going? Are they going to be more intelligent than myself? Otherwise, I'll be making the same mistake that I made in the past years. Digital natives. Well, that one was born in the digital era and they know everything. And that's not right. I was born in the writing era. And not because of that, I was good at writing. I had to learn how to write. So, sooner, late, sooner, Sonia was talking about meaningful connectivity. If in the next 4 or 5 years we are going to lose 500 billion US dollars, who is going to lose it? Brazil is not going to lose 500 billion. I'm pretty sure we are not going to lose. No, there are 8 international companies, American companies, which domain have the domain of the technological scenario. So they are going to lose, but you have to say who is going to lose, not just, simply say they are going to lose, but who are they? And also I'd like to know or to hear from you. So far, there is no scientific evidence that digital technology helps in education. I don't know any survey or any research which supports such a matter. If you know, if anyone knows, please let me know. And what is your opinion about the non-use of cell phones in the school? There are several studies saying that people need daily attention, concentration. This is cognitive approach. Is there any new surveys or researches or studies about what is the time of a child attention who is at school today? That number might be different from the 80s. Thank you. One last intervention, and then we can go for the answers.
Boa tarde.
Hello, good afternoon. My name is Flora. I am a researcher on AI in education, and I have a question about this topic. Take into account the use of platforms, solutions in inverted commas in the public educational systems. I follow in the classrooms some of those cases here in Brazil, and Cristóbal has highlighted adaptation, quality of implementation, and scalability. If you could elaborate a little bit more about this topic. I mean, how communication ministries, education agencies could advocate for the quality of implementation, as there are several gaps into the language adaptation, curriculum adaptation, expectations in terms of results, a huge focus into the use and not so much into educational results. If you could, add something, I would appreciate. Thank you. Let's start with a round of answers. Who's first? I will not answer to all of the questions, but I'd like to make a comment about the presence or not of having smartphones being used in the school settings. That is also a reality in Portugal. Actually, is a worldwide concern. According to the 2023 UNESCO survey, did not recommend the prohibition of cell phones, but just, adding cautious as how cell phones could be used into a motivated way. But the newspapers and the journals, they prohibited, as if UNESCO was the one responsible for such a prohibition. We in Portugal, we try to do differently. We know that youth, they have their smartphones, they have their cell phones, and according to Kids Online ICTs, 93% of youth, they do their homework throughout digital platforms. If they don't have, if they can no longer use the smartphones, come on, how can they work? How can they do their homeworks?
de uma maneira crítica, aprender a
How
fazer
can they
pesquisas,
critically learn to carry
estimulantes,
out motivating
desafiantes na
surveys or
internet,
researches or
usando,
challenging in the
usando
web?
esta procura que eles fazem de respostas na inteligência artificial. E
They
aqui a
look for
escola, eu
searches now
considero que é o grande
and
avanço no
answers
currículo
in
livre,
the
porque
artificial
em muitas
intelligence
famílias não
apps.
há esta possibilidade e na escola há. Nós fizemos um webinar
We had
aberto a professores
conducted an open
e a nossa
webinar
estratégia
to
foi,
teachers and
primeiro,
professors, and
apresentar
our
todo este enquadramento, a tendência que
strategy
está a
was
haver
first
para a
to
proibição dos celulares. Em
talk
Portugal,
about
a
cell phones
política é de
prohibition. In
recomendação de
Portugal,
que
there is a
os estudantes
recommendation
mais velhos
that
sejam
older
envolvidos na
students
definição de
would be
regras sobre
involved
como usar os
as
celulares,
how to set the
nomeadamente os
rules
estudantes
and the
desde
best use of cell
em
phones,
relação aos
especially
mais
those
novos,
in the high
não,
school.
portanto, há
Younger students, on the other hand,
claro dizer
they
não
would
à proibição do
not be
celular,
able to
mas
use
há
the
esta
cell
orientação
phone.
para
But, the
tornar os estudantes
recommendation
também
is to
atores que
involve
fazem parte da comunidade
students as
educativa.
stakeholders because they are
Também
part
fizemos,
of the
e isso penso que foi
community,
muito
the
importante,
educational community.
neste workshop, e apresentámos
And during the
possibilidades
workshop,
educativas
we
de
had
aplicações
introduced
disponíveis
some possible
gratuitamente no
educational
celular.
activities
E
that
pusemos as
were
pessoas a
available for
discutir sobre
free
isso.
in the
E isso, o resultado
smartphones.
foi muito
And people
estimulante.
got
Portanto,
involved,
eu
and we
não
have
posso
achieved
falar
wonderful
pelo Brasil,
results.
porque não
I
conheço,
cannot,
mas penso que
talk
está a
on
haver um
behalf of
pânico em
Brazil, but I
relação
think there is
à questão do
a
celular
panic
que ignora,
about the use
quer
of cell
queiramos, quer
phones,
não,
which
o
will
grande
ignore
requisito que as crianças têm na
the
sua mão
needs
para seu
of the
uso
use of
e
this
que
device. Children,
saberem
they want to
tirar
make use
partido
of that
dele,
and to
dos
take the
seus
best
recursos, de
use
uma maneira
of a
crítica,
smart cell
inclusive, como dizia esta
resource in a
manhã,
critical way is
desligarem,
what we
estarem um
expect,
tempo sem
and
estarem
not
ligados.
just to be
Isto é toda
prohibited
uma
at
discussão que
full.
também
And
parece que
that
passa pela
is a
educação.
discussion that, has to do
Obrigado.
with the educational field.
Patrício.
A ver, me quedé pensando en la intervención. I was thinking about your intervention. I would like to answer in Spanish. Can I do that,
Yes.
please? It's more difficult. ¿Ah? No hay pero se entiende más o menos. Sí, se entiende.
Vamos.
Qué bueno.
Understand? Oh, yes, you can.
It's very difficult for me to
Come
speak
on.
in English. It doesn't look like, but it's very
It's
difficult. So, pero para poder lo
it's
puedo
very
hacer
difficult for
lento
me
como
to
para,
speak
para
English.
exponer.
I'm going to do it slowly.
Hay dos
So,
o tres cosas que
there are
quisiera
2 or
decir
3
sobre esa
things
intervención, porque
that are
es una
related to
legítima
this
preocupación
intervention.
el
It
pensar que
is
efectivamente el
a
uso de
concern
tecnologías
to
digitales
think
puede
that
afectar los
effectively the
aprendizajes y el
use of
bienestar
digital
de
technology is
niños,
related
niñas y
to
adolescentes.
learning of children and
Es una
adolescents.
legítima
So
preocupación el
this
que
is
efectivamente nos vemos
a
haciendo algo
concern
tal vez
that
demasiado más
is
tiempo del que
grounded,
quisiéramos.
that is legitimate, fair.
Sin embargo, lo que
And
es más
however,
consistente en la
what is
investigación
the most
es que
consistent
los
in
usos, por ejemplo, del celular o de
investigations
otras
that the
prácticas
use of
digitales
cell
no tienen
phone
una
or
relación
other digital
lineal.
practices
Espero
does
que se
not
entienda
have
el
a
concepto de un uso
linear
estadístico,
relationship,
es una relación lineal
a
ni con el
linear,
bienestar ni con el
this is a
deterioro de habilidades
statistical
cognitivas
concept.
ni con los aprendizajes. ¿Qué significa esto?
It's not
Que a
related
cada
to
minuto que
learning, meaning
sumas
that every
vaya
minute
bajando
that
tu
you add,
bienestar, cada minuto que sumas vaya
it
bajando tu
goes
aprendizaje, cada
down,
minuto que sumas vaya afectando, por ejemplo, una
learning, or
habilidad
then
cognitiva como la
affects, for
atención.
example, your attention or something.
¿Qué es lo que sí tiene mucha consistencia en la
What
literatura y en
is
la
very
investigación?
consistent in the research
Que hay un
literature
grupo de
is that
niños,
there
niñas y
is a
adolescentes
group
que
of
son
children and
heavy users, que
adolescents
utilizan muchas
that are
horas.
heavy users,
Pero
that
lo
use
que
it for
encontramos no es
many,
una
many
relación
hours. However,
necesariamente en que
what we
podamos establecer
find
una
is
relación
that we can
causal,
establish a
sino que encontramos que ese
cause-effect
grupo es un grupo
relationship,
que tiene además
because this is a
características
group that
específicas
has
distintas del
very
resto. Por
specific
ejemplo,
features different
hábitos de
from
vida
the others.
saludable deteriorados, peor sueño,
For
peor alimentación.
example, a
Son niños que
worse
además vemos que tienen, por
sleep
ejemplo,
and
indicadores de
diet.
bienestar
They have
subjetivo,
worse life
que
habits than
también
other
se sienten con
children.
distintos instrumentos
So,
descendidos. Y no podemos establecer una relación
so we
porque
cannot
sea la
establish a cause and
tecnología la que
effect
gane.
relationship. Is it
Son niños que
the
tienen, por ejemplo,
technology?
menor apoyo
The
en la
children
familia,
have
menor
less
apoyo familiar,
family
y hemos
support
medido, existe investigación,
that is
que tienen
measured.
menos mediaciones
They
activas
have
también en la familia.
less
Hemos visto
active
además que las
mediations in
mediaciones
family,
restrictivas
and
no
also
parecen
the
conducir a una reducción significativa de los
restrictive
riesgos. Y eso es muy consistente en
decisions
la
or
literatura.
measures do not seem
Entonces,
to
lo que
have an
ocurre en
effect.
ese
This is very
sentido es que
consistent in the literature. So
es
what
muy
happens
importante
with
que
that
pongamos
regard
la
is that
atención
it
en
is
que hay
very important for
grupos
us to pay
de
attention
niños y niñas
which
en
groups of
riesgo
children
que
are at
reproducen además
risk,
riesgos en los
that
cuales otros niños han estado
reproducing and
antes
are
de las
at
tecnologías
greater risk
digitales.
than other
Son niños más
kids,
solos,
a-
con
and
menores
they are
relaciones con otros
children who
niños,
are more
son niños a los
lonely,
cuales además los adultos
and
les
then
dedican menos tiempo.
they
Entonces,
the
lo que
family
tenemos son
spends
grupos de
less
riesgo que
time with
nosotros hemos
them.
identificado, donde
So
sí
this is very
efectivamente
clearly
hay
identified
también
where there
peor
is
desempeño
clearly
escolar,
a worse
malas notas, ¿sí?
school
Y también
performance,
tenemos
lower
desintegrar
grades, and we
aquellas
also have
habilidades socioemocionales que les permiten enfrentar ciertas situaciones
they
riesgosas
also
o
have worse social
dañinas. ¿Ya?
emotional
Entonces,
skills
no quiere
than
decir
the
que no
other
nos
groups of
preocupe que
kids.
utilicen
So it
mucho las
doesn't mean
tecnologías,
that we are not
sino que
worried
tenemos
that
que
they
preocuparnos de
overuse
aquellos que
technologies,
las
but
usan
we
mucho y
need to be
además
worried
parecen
with
ser
those
los mismos
who
que
use it
están en otras
excessively,
situaciones de
which seem
desprotección.
to be the same
Entonces,
children who are at other
n- n-
risks,
y
not
solo
just in
agregar una
terms of
cosa más,
technology. Just
em,
another thing that I would like to
quitar
add,
las tecnologías o
we
quitar el
need
celular
to
de la
take
escuela
out the cell phone
a
from
veces nos
schools and
puede
take the
llevar a falsas
technologies. Sometimes
interpretaciones de lo que
it
estamos haciendo.
might lead
Muchos
to
de
a
los riesgos más
false
importantes
interpretation
para
of
los
what we are
niños,
doing.
los que
Many of the
ellos
most
dicen que son los
important
más
risks
importantes,
for the
por
children, the
ejemplo, el
ones that they say the
cyberbullying,
most important,
no
for
ocurre
example,
dentro de la escuela,
cyberbullying, is not
ocurre
inside the
en
school.
otros espacios,
It takes
fuera de la
place
escuela,
in other
ocurre en
spaces
otros espacios donde
outside
la
the
escuela no
school.
está.
It
A mí me preocupa
it occurs in the
personalmente
spaces where the
que
school
cuando
is
queden
not. To
totalmente
me,
fuera
I'm
de la escuela,
personally
si es que
worried
eso
that those
ocurre,
who are
los
completely
celulares,
outside
la
the
escuela,
school
cuando
with
les
their cell
digamos
phones
qué
alone,
pasa con esta situación de
and
cyberbullying,
then
digan,
what
no es
happens
problema
with
nuestro.
cyberbullying?
No es problema nuestro porque
Well,
aquí
the schools
no hay
say, well,
confianza
this is
mutua.
not our problem.
Es una
There's no
preocupación
cell
que tenemos
phone
que
in the
considerar.
school. Well, this is something.
Excelente. Ana.
Vamos lá, vou tentar comentar, acho que algumas das questões
Anna,
que foram
well, I'll
trazidas.
try and
Acho que
comment some
primeiro em
of the
relação à
issues that
questão
you
da
have
atenção dos
mentioned.
estudantes
First
e
is the
como está
attention
sendo aqui
span
no
of
Brasil a
students and
discussão
how
sobre a
we are
nova lei
talking
que
about the
restringe o uso de
new law
celulares nas escolas,
limiting
né.
the use of cell
Acho
phones at
importante
schools.
trazer que a
I
lei
think
ela
it's
não proíbe
important to say
completamente o
that the
celular
law
dentro
does
da
not
escola,
completely
né, ela
forbid
limita
having a
o
cell
uso
phone inside the
para
schools.
o
It
uso que
limits the
é
use to a
mediado pelo
use that will
professor,
be
né, o uso que
mediated
tem
by
uma
teachers
finalidade, né.
that has a
Então,
purpose.
e a gente tem reforçado
So
bastante
we
isso,
have been
pelo Ministério
reinforcing
da
greatly
Educação,
this
todas as
at the Ministry
orientações,
of
né, do sistema de
Education, all
ensino,
the
porque essa
guidelines and
diferença é
directives,
importante, né. Eu
because
concordo,
this is an
Cristina, que a
important
gente
difference.
precisa,
I
se a
agree
gente
that
tira só o celular
if
do
we
estudante,
just take
ele
out
fica
the cell
completamente à
phones from
mercê em casa,
students,
por
they
exemplo,
are
e também não
completely
consegue desenvolver o que ele precisa
vulnerable
realmente
at home
desenvolver
and they
dentro
do
daquele
not develop what
dispositivo,
they need
por
to
exemplo, para a
develop with
parte de
that device,
pesquisa.
for example, for
Então a
research.
gente, né, a orientação que vem
So
sendo dada de
the
implementação,
orientation that
dessa
we are
nova
giving
lei
for the
é muito no
implementation of
sentido
this new
de,
law
não é
is
na
very
hora que o
much
estudante quer,
related.
no
It's
momento que ele
not
quer, na
whenever
escola,
they want
porque
that they're
esse
going to
uso
use it.
ilimitado, né,
It's not
tem prejudicado a
unlimited
atenção,
use. This
mas
has
quando o
affected
professor, né, vai fazer
attention.
uma atividade
But when the
orientada com os
teachers
estudantes,
has
ele
an
é absolutamente
activity that is
incentivado,
guided with students,
a
yes, then
usar
they
esses
are
dispositivos
encouraged
e
to
fazer uso
use
desse
those
dispositivo dentro da
devices
escola,
inside the
principalmente
school,
quando a gente está olhando os estudantes com
especially
mais
when we are
autonomia,
looking
que precisam
at
já fazer esse uso
students
mais
with more
ativo, acho que um pouco
autonomy
diferente da
that
discussão quando a
need to
gente
be
olha para as
more
crianças
active. It's
pequenas, de
slightly
educação
different
infantil,
from when we
e de
look at
fato o reforço
little
de
children in
não porte,
kindergarten,
inclusive, desses
that
equipamentos.
sometimes they shouldn't have
Comentando um pouco a
one of
questão
those
dos
devices.
nativos digitais,
Now, a little bit
acho que é muito
about the
importante a
digital
gente
native
entender que
people.
existe uma
So it's
diferença
very
entre
important to
você, um
understand there is
estudante
a
que sabe
difference
usar o
between a
celular
student that
e
can use
sabe
the
usar a
cell phone and
tecnologia
then
para
can
uma série
use
de atividades
technology for
completamente
many
diferentes, né.
different
Então acho que
activities that are
tem
completely
saído aí
different.
muitas pesquisas que mostram a
So there
dificuldade
are
muitas vezes dos
there,
nativos
lots
digitais,
of
às
research has
vezes
been
de preencher uma
published on
planilha
difficulties
de
of
Excel, né, fazer
digital
algumas
natives,
atividades,
difficulty to
de
deal
que
with
são
an Excel
diferentes de simplesmente
spreadsheet
abrir
and
um celular e
activities that are
acessar redes
different from just
sociais.
opening a
Eu
cell
penso que é
phone and
tão
access
importante
social
discutir um
media
pouco mais no
or
micro
social
o que é essa
network.
educação digital que a gente
So we
precisa,
should
e como precisa sim mesmo para
discuss in
quem
more
é um
detail
heavy user já
what
de
is the
tecnologia, né, que
digital
são usos
education that we
diferentes,
use,
e acho que se
that we
trata muito
need
dessa
even
qualificação
for
desse uso, e
heavy
também
users of
muito no sentido
technology.
desse
And this is
letramento
very
digital, a
much
gente falou muito
related
sobre a
to
questão da
this
linguagem,
digital
eu acho que da
literacy.
importância
We
dos nossos
talked a lot
estudantes
about language and
entenderem
importance of
sobre
our
algoritmos, né,
students
entenderem esse
understanding
pensamento
about
computacional,
algorithms,
para conseguirem entender com
computational
quem
thinking to understand what they are interacting with when they do research on GPT or use AI companion, for example. So this digital literacy is very important to be inside schools. And to say how much digital technologies help in education, I think that the colleague has said a few things with good indicators. And I think that there is a debate, and as digital technology comes to be able to revolutionize the teaching of literacy, but we need to teach our students to use technology too. So it's important to separate these two debates when we are talking about technology inside schools. And lastly, to talk about platforms with the use of artificial intelligence. This is a very important debate. This was very much discussed at G20 last year, which is the concerns that we need to have now in terms of the platforms that have inbuilt AI and how big techs indicate when there is inbuilt AI, how it's been trained, which is the data set. And there is a discussion between different countries about the concern and the national content, and many platforms that are just translated to different countries. And this is a very important debate for us to qualify at the ministry, discuss how much we should have more contents that are assessed to subsidize the development of platforms with the use of AI that has this vision of our context, our syllabus. So it is important for us to look at the issue of quality that gets to these platforms and everything that gets into schools.
Gustavo.
Okay.
Well, I love the question about where is the evidence. I think we have to ask ourselves that question every single day if you care about education more than technology. My reading of that is today the evidence is patchy, is imperfect, is incomplete. It's not a one size fits all. The OECD show us that some amount of exposure to technology is useful, but if it's too much, doesn't lead to good results. So the bad news is this is not magical, period. The second one is the ICILS, the International Computer Literacy Information Literacy Study that was published just a few months ago with 30 plus countries on the same age of the PISA, show us that the level of digital proficiency of kids is fairly low. I mean, 50% of the students don't go above the basic level. And that has not changed in the last 10 years, meaning that we are not improving the proficiency of the students. It's not the amount of technology, but it's the quality of the experience. I think that says a lot about the homework we have in terms of how to translate these initiatives into something that really will upskill the capacities of the students. There's a question how to do this thing at the system level, how to ensure high quality of implementation at a scale. Well, that's another tough question because I think now that we are in a switch of paradigm, we will have to allow us time for having a system change in terms of upskilling decision makers. For me, a clear example is teachers will hardly be able to teach about AI if they're still using AI detectors, which are not reliable, right? So we have to give the teachers tool to be well equipped to navigate this thing. And finally, a word on AI. AI, I totally agree, it's not a happy concept because it means many things as it's not the real understanding that we have of intelligence. But there are two streams here. One is tools for automating and tools for augmenting capacities. I'm in the game of augmenting, but in order to augment capacities, you have to have core skills. You cannot learn if all the things are done by the system on your behalf. So we have a lot of discussions to have in this regard, but I'm confident that within the next 20 years, we will reach there.
Claro que a mesa aqui também não pode deixar de
Of
fazer
course, the
comentário sobre a
panelists,
importância,
and I shouldn't fail to mention the importance of the debate about digital inclusion
no contexto da
that takes
diversidade
place within the
de
context
cada
of
criança, de cada
diversity
adolescente,
of
de cada
each
jovem, de cada
child,
adulto.
adolescent,
Eu
youth,
acolho
and
aqui o
adult.
apelo para que a
So
gente
I would
inclua,
like to
né, a
hear the
questão
appeal for us
da
to
síndrome de
include
Down nesse
Down
debate,
syndrome
né,
people
seja
as
na
part of our
questão,
debate
né, do controle
on the issue of parental control or in terms of the development of technologies that might help the inclusion, respecting diversity. This is a theme that we all are sensitive to, and we are committed to understand more about this context and to study at the same time as respecting the different profiles, contexts, vulnerabilities, and strengths, capacities, skills of each child, adolescent, youth, and adult within the context of digital inclusion. So before wrapping up, Professor Sonia, any comments? Now optimistic, please.
Well,
No, sorry. It's a joke.
can I did want to say one thing, which is one of the 42 rights is the right concerns the rights of children with disabilities. So thinking of your son, we don't have enough research, and one of the difficulties, to take us back to the question of research and evidence, is the challenge of getting disaggregated evidence so that we don't find ourselves talking about all children as if they are the same, or even all 11-year-olds or all 15-year-olds or all 29-year-olds. Of course, they're not all the same. And we really, and it's a crucial investment, I think, that a society must make, that we have sufficient evidence about the different groups that matter. I think what we know, and I'm thinking of my research on parenting for a digital future, where I interviewed parents of all kinds of children, and also a Council of Europe study on children with disabilities and technology, or children with special needs and technology, was something about intensity. That the technology both offers particular kinds of hope, because it offers particular help or ways of engaging that may not be marked. Maybe it's not always apparent what are the particular difficulties you may face, but at the same time, it's a unique vulnerability. And it can, and children can be exploited precisely for that vulnerability in the digital world, with impunity in ways that can be very painful. So I think we have to kind of mobilize the stakeholders here, but also those who speak for children with Down syndrome, those who speak for children with various disabilities or vulnerabilities. There's so many we didn't mention. All those other articles, children who are refugees, children who don't live with their parents, so parental controls is not the point. Children who live in alternative care. I'm just afraid it's a very big task that we must all rise to. I agree with the challenge.
Thank you very much. Muito obrigado a todas e a todos. Agradecemos a participação de vocês.
Thank you so much for your participation, and we're waiting for you tomorrow morning. So just a few housekeeping messages. I would like to thank the valuable reflection and analysis. And could you please go to the center of the stage for our last photograph of the day? And tomorrow we're going to resume at 9:30 in the morning, talking about themes that are essential for the future of the digital economy, such as digital economy, information integrity, and impact of technologies. For those who are here, please wait for another few minutes for some final messages. And those who were with us through the online transmission, thank you very much for being with us, and we wish you a very good evening, hoping to have you with us tomorrow. See you tomorrow. For those who are here, we